prevention of violence since 2012. Her research interests focus on addressing the root causes of violence by creating the conditions that support healthy human development throughout the life course. She has designed and conducted several large-scale projects in schools and in community settings, and is currently working on a large federally funded trial in 44 middle schools in Colorado. Her PhD in sociology is from the University of Colorado, Boulder. And so this next session, before they come up, let me just sort of give you the gist of it. This next session is intended to help us review what do we know now about what's going on with respect to school violence, what have been some of the accomplishments and improvements over the last 20 years. That's what this segment is. And then when we come back after lunch, we'll be moving more to, okay, what do we do next? How do we get going and move things forward? So that's kind of the lay of the land. We're making a progression here from the past to the future. So Mark?
Wow. So first of all, thank you very much for inviting me here. I'm both humbled and flattered to be here, and amidst so many distinguished speakers. I first met Deborah. I'm not going to say how long ago because it'll give away how old we are, or how old I am anyway. It's just a great honor to be here, and some of what I'm going to say has already been said, so I'll just try to go through it pretty quickly. It's the top button, right? So thank you very much. It isn't the top button. Is it the middle button? Do you know? Middle button. It is the middle button. For anybody else who goes next, it's the middle button. I just want to point out the idea of youth violence in general, that there are both many antecedents and consequences, and the youth violence has an effect on all of these different things, everything: injury, disease outcomes, risk behaviors, life opportunities, and mental health problems. But it's really, these are they could be a double-headed arrow, because some of the things on the outside of youth violence here also influence youth violence behavior. And so the idea here is that it's complex, and we have to think ecologically. And another point I think of my remarks is that sometimes we have to work. You don't work exactly on youth violence to address youth violence. So we think ecologically, we think about interdependence, and we think about settings. So let me go on and just say that some of my own work, we've found that kids who had a head injury were more likely to be violent. Self-reported concussions that wasn't even diagnosed. We're working on a paper right now that we're just submitted for publication, where kids who've been exposed to violence actually report worse cardiovascular disease 15 years later. And by exposure to violence, I don't mean necessarily being victimized, but witnessing it in their communities, conflict in the family, and then also being an actual victim. We actually found those effects for women. We studied they were 15 years old, high school kids. They reported a positive pap smear. Then those who reported a positive pap smear were more likely to have experienced violence in the same ways I just described in their high school years. Alcohol, drugs, and smoking, it's a cause and a consequence in many different ways, but we find that violence and these factors are certainly related. And then, of course, mental health. I'm including in youth violence both perpetration, victimization, as well as suicide. So the three sort of big risk factors for school violence are being bullied, being victimized, and fighting. So let me quickly just go through some of these data. 30% of kids are bullied. That could be indirect or direct. It could be physical, verbal, or cyber. Cyberbullying is on the upswing these days, but 30%, 1 in 3. About the same number have reported being victims, which of course you'd expect. It's not always the same kid. And then this was surprising to me, and this sort of points out the need to think about the bystander work that is being done, efforts to say something, and then the reporting systems. But 71% of kids said they've seen people be bullied before. They need to stand up and say something. They need to stand up for the person being bullied, and they need to report it to people as a way, for that middle part of the secondary prevention. In terms of physical fighting, 23% of kids are fighting. That's actually about 50% less than it was 25 years ago. So we're making some headway in this regard, but still 1 in 4 kids report being in a physical fight. And we heard about some of the sex differences before, and I found this pretty interesting, that it's not just boys who are in fights, but girls get in fights too. Obviously more boys are more likely to fight than girls, but girls get into fights as well. The other thing that is interesting about this data is there is not a race difference here. It's about the same for black kids as it is for white kids. So those are sort of some of the precursors about violence, precursor of violence in school and in behavior more generally. So let me just talk a little bit about weapon carriage. So we also heard about research on guns in particular, and this is another theme I'll talk about in a minute. But most of the research that's been done to date has been mostly talking about weapons, not guns per se, because of that Dickey Amendment. And so one of the ways researchers got around that, we said, well, we'll ask the question as weapons rather than just guns. Most of this is guns, some of it's knives, but it also includes clubs. And I mean clubs as sticks that you hit people with. But 4% of kids have reported carrying a weapon in school, 4%. That's actually down from 5% from about 10, 15 years ago, but 4%. The average size of a school in the United States, high school in the United States, this is high school kids, average size of high school in the United States is about 500. Here in Colorado, it's about 480, 490, so it's right about the average. And clearly there's many schools that are much bigger. We heard about schools of 1,500 and 1,000. But if you think about the average, if it's 4%, to give you a sense of what this is, that's 20 kids in that year will carry a weapon to school. A gun, a knife, or a club to school, 20 kids in that year. And that means that there's 2 incidents of carriage a month on average. So if you think about that for a minute, that means every other week there's a gun being carried into school. And the question is, why? Why are they carrying a gun to school? Maybe because they've been bullied. Maybe it's because they're trying to be protective. Maybe because they want to do something negative, but with that weapon. It might be for any number of reasons, but 4% do. 6% have reported being physically hurt or threatened by one of those 3 means. In the most recent data that we have, which is several years old at this point. I think this is from 2015 or 14. 6% have reported being threatened or hurt by a weapon in school. Since 1970, 50 years ago, about 50 years ago, we've had 1,316 school shootings. Let me also say that some of these data, depending on where you look, I've tried to pick more conservative numbers. Some people might report a little bit more, but that's 1,300 school shootings. There are 82 last year. I've seen numbers in the 90s. Again, why they're different, it might be the different ways they're talking about shootings, whether people are hurt or whatnot, but 82 last year. That's 6%. Over the last 50 years, 6% of the school shootings that occurred in the United States occurred last year, over 50 years. Seems pretty amazing to me. We're not doing better, and one of the things is we can do better than this, and we have to do better than this. So let's just break down some of the data by that's happening in schools, and Most of the shootings that occur, incidents that occur in schools, are handguns. You can see here it's by far and away the largest number of incidents are using handguns, which makes sense, of course. That's easier to sneak into school, right? In terms of age by shooter, it's sort of interesting to me that in 300 of the cases, 300 of those 1,300 cases, the age is unknown, probably because early on we didn't really collect that data, is my guess. I don't exactly know why you wouldn't know the age of the shooter. Most of the time the shooter is caught, so it's probably not recorded. But the other thing that stands out here is it's youth who are actually perpetrating that. These behaviors. You can see their ages, most of the age ranges of the activity of doing this activity is basically 14 to 18. What years are those? Those are the high school years. So if we think about prevention, we might think and we think ecologically. One of the things this tells me is first we got to focus on handguns in some way. And secondly, we have to think about high school years or middle school years, perhaps, because that's what precurses, the age that precurses high school years, obviously. And if we look at incidents by injury and who were killed by those incidents, and if you look at this over time, you can see there's a few blips here and there, and if you drew a line there, it slightly goes up until 2017. And you can see there were 154 incidents where somebody was injured or killed in a school. We have to do better than this. It can't, this is going in the exact wrong direction. So the other thing I just want to say, and I'm going to now talk about more about firearms in particular, but if we look at the school shootings, all those data that I was just talking to you just now, only about 1% of homicides happen in school. Most of the other ones are happening outside of school. However, schools are the place where youth spend most of their time. So what happens at school may have an effect on them outside of school, where most of these homicides are occurring. So that's not in any way to diminish the importance of school violence and the school activity, the school violence that occurs in the building itself or on school grounds. But this is a problem that extends far beyond schools. Schools can be a focus. I like not to say a target population because we're talking about violence, and to use the word target just doesn't make any sense to me. So it could be the focus. And needs to be a focus. It's a place where kids and youth are. But the real problems of what's going on is actually outside of schools when the incidents actually occur. But if we think about prevention, we have to think about where are the settings to do the prevention, and certainly schools are one of them. So let's talk a little bit about firearms. 8 kids die every day from a firearm. 8 children from 1 to 18 years old dies of a firearm. That's got to change. And if you do the multiplication, you can see that it's about 2,000 people. Firearms, you saw that, you heard Deborah talk about this. It's the number 2 cause of death for kids 1 to 18 years old. Motor vehicle crashes are number 1. Malignant neoplasms is basically cancer, is number 3, and firearms are right there at number 2. It's the number 1 cause of death for African American kids. All of the injury and death that occurs, 1 in 5, 20% of injury and death among high school age kids, 14 to 18 years old, is a result of firearms. African American kids are 14 times more likely to die of homicide from a firearm than white kids. We have to do better than this. And when Deborah was talking about the structural factors, the issues that we think about. We were just, some of us were just at a meeting talking about the narratives, and Deborah sort of pointing out about the idea that, well, yes, it's the police did that because they had to. It was self-defense. I don't even remember what the terminology was. It's not an accident. It's not that black kids are more violent. It's the structures of racism that takes place and that distinguishes, that separates people. The redlining that occurs that keeps people in different places in the community where there's more poverty, and we saw that poverty is related to firearm and violent deaths. So we have to and we can do better than this. We look at pediatric firearm injury. This is slightly different data than what Deborah presented, but 2/3 are from homicides and assaults, but a full third are from suicide. Where's that coming from? We heard about it. Maybe it's isolation. It's clearly social relationships are happening. Some of it could be organic, but suicides are something that are absolutely positively preventable, as are homicides. Unintentional injuries, typically that's often very little kids who get a hold of a firearm in the house that's loaded, and they're playing with it and they accidentally shoot their sibling. You hear about those stories all the time, often, too often, but that's what the unintentional injuries are. Deborah showed this slide. The two arrows point to Columbine and Newtown in Connecticut. The point to me of this, one of the points to me of this slide, the red line is firearms, the gray line or black line is motor vehicle crashes. We're able to do this for motor vehicle crashes. You can see the slow decline over time. And it took all sorts of things and all sorts of strategies back to that ecological notion of intervention. There were technological changes. Our seatbelts got better. We went from a lap belt to a shoulder belt. We did education. We changed policies. Police officers could give you a ticket for not wearing your seatbelt. Now a child doesn't go into a car without putting on their seatbelt. It's just like automatic. All of us probably. It's automatic. When I was a kid, you know, seatbelts like, oh, you know, it's a free country. I don't have to put on a seatbelt. I remember a emergency physician told me, work in the emergency room for one day and you'll see why you need to wear a seatbelt. And she was talking about people who were going through windshields or smashing into the steering wheel. So we can do it. We were able to figure out how to have an airbag pop out of the steering wheel at 200 miles an hour, and the worst it does to you is maybe, depending on how it hits you, of course, if you have your thumbs there, it could break your thumbs, it could break your nose, but you're not going to have a severe injury from going into that steering wheel. We could do that. We had educational programs where we taught parents how to talk to their kids about driving, and we created driving schools, and we created policies where graduated driver's license. So we knew that the area of time that was most dangerous is when you're a first early driver. The graphs are very, the most crashes occur at early driving, and then later, when you're about my age, it happens again when you get to the other end of life. And in between, we do pretty well. So we have this graduated license, so kids can't drive without their parent, then they can't drive with kids in the car, and it takes 2 years to get them to a full license. We can do that with firearms. There are technological responses that, you know, we probably don't even know what some of them are yet. But we do know that there are all sorts of lock boxes and other kinds of strategies that we can do to make the technology. There's fingerprint, so the firearm can't shoot unless it's your fingerprint. We can do it on our cell phones. We certainly should be able to do it on a firearm. And I've heard people who own firearms say, but if it's for protection and I got to get my finger exactly on there, we can make the technology better. I can do it on my phone pretty quickly. So we can make that technology better. We have to make that technology better. This is something interesting. And again, this is something similar to what Deborah was showing. But if you look at urban, suburban, or rural differences, what comes out, most striking, these are the 5 leading causes of death. Motor vehicle crashes happen more in rural areas. That makes sense. Kids are more likely to be in cars because things are far away. The highways in rural areas are not all lit up like they are in an urban or a suburban center. And they're also going at faster speeds potentially. Even if they're doing the speed limit, it's 40 miles an hour, 45 miles an hour, might be 55 miles an hour. If you're in an urban center, you're not going that fast, probably. And if you are at 55 miles an hour, you're speeding probably by 20 miles over the speed limit. So that makes sense. But look at the firearms. There's no differences. We often think about, oh, it's different depending on the context, and it really isn't. What might be different is what happens in the different places. Maybe it's more homicide in urban areas and more suicide in suburban and rural areas. And that is so far what the data say. That was that graph that Deborah showed earlier. That was sort of the trend if you looked at that data as well. But the firearms are not just an urban problem. And then I'm going to close with a couple of other slides here. One is this slide, and this kind of also goes to what Deborah was talking about earlier. So I'm just I'm supporting somebody who I've respected and followed for all these years. So, but this data basically show that we have had such a positive research on gun violence and gun morbidity and mortality that has to stop. If we have the data, we can make changes. This is the United States of America. We can land on the moon. We're talking about sending people to Mars. We have a space exploring vessel it just passed Jupiter. We can do better than this. If you look at this data, just to help you read this slide, there were 20,000 deaths of firearm injury from 2008 to 2017 among youth. We had 32 research awards of an average of $1 million. That's about $597 per death. 504 articles were written. So we know a little bit. But now look down at HIV. We had 91 deaths and $25 million per death. Now that isn't to say that we shouldn't do research on HIV or we should cut data and research on HIV. Don't get that message here. The message is we need to move firearm injury up. We need to find funding and we need to have a more attention paid to firearm injury so we can develop the technologies so that gun owners can feel comfortable that that gun can still protect them. And so they can, so we can understand what are the strategies to encourage parents to, if they're going to leave a loaded gun in the house, how to lock it up. And what are the educational efforts to do? We don't know much about that, and we need to do more about that. But if you look at motor vehicle crashes, 33,000 deaths, $26,000 per death, 2,000 articles. The other thing that struck me on this graph, and I'll get off it right in a minute, but tetanus doesn't kill anybody. Now, obviously, there's a lot of morbidity that occurs. Morbidity that occurs with tetanus. But we spend $4 million per case, about on the number of deaths, and people don't really die of that disease. So we can do better than this. We spend almost between $8 and $9 billion a year on medical costs alone. And this graph is showing that we spend, when you estimate loss of work and other kinds of services, mental health services for the family, the PTSD that we talked about, we estimate to spend almost $230 billion annually on firearm deaths in the United States. Now, this is all firearm deaths. This isn't just kids. That's like 7+ times what we spend on foreign aid. And it's almost how much we spend on Medicare. We have to do better than this. And we would save so much money. And what could that money be used for? Sending another moonshot or going to Mars or making guns safer. Let me just end with a commercial. I'm sorry for that, but basically I just want to say this. We are doing some work at the University of Michigan and nationally. Our Michigan Youth Violence Prevention Center, we do work on community development, and we work in cities that are basically Rust Belt cities where there's lots of vacancy, and then cleaning up and greening and seeing how those how changing that community context can make a difference in kids and in people's lives. And I can say that pretty confidently that it makes a big difference, that we're finding what other researchers have found in Philadelphia, in Youngstown, we're finding in Flint, and we're also doing some work in Youngstown and Camden, and we're finding that if you build it, they will come, and creating a busy street and a healthier environment is a way to reduce violence. Our firearm safety among children and teens FACTS consortium, we have a member, someone here, there you are, Eric. We are working on trying to address the dearth of research by bringing together researchers. We've done literature reviews to identify what are the different areas of the low-hanging fruit and more long-term, so short-term and long-term kinds of research questions we should be doing. There's a funding program for postdoctoral fellows to start increasing the pipeline of researchers in this area. For a long time, people were told, don't go into firearm research, there's no money in it. You're not going to be able to make, you're not going to be able to make a career. There's not enough going on there, and we're trying to dispel that myth. We're also creating a database of all sorts of data that people could start a one-stop shop for data on youth violence, particularly firearm violence. And then we're doing some work with Sandy Hook Promise. They also have anonymous reporting systems that they tie into their program of Say Something, which is the bystander work. And so I'm moved by the work that they're doing. So these are three things that we're doing. And I'll just end there and say thank you very much. Appreciate the time and appreciate being here today.
This is where I need a step stool. Okay, can you see me? All right. Okay. So District Judge and former Columbine Commission member Don Quick told me two things about prevention that have never left me. The first is that what he heard most often from crime victims was that they wished that their crime had never occurred, that it could have been prevented. Second, he said, prevention makes sense. Sense with an S and sense with a C, as in dollars and cents. My life's work has been dedicated to prevention, and I've had some really amazing teachers and mentors along my journey. My greatest mentor in my work is Dr. Del Elliott, the founder of our center. Many of the points I will make today, I have learned from Del's prolific research and his deep commitment to take research to practice. Okay, I did it. I'm proud of myself. Okay, so today I will share lessons learned that inform our thinking about school safety, identify what we know from research works to create safe schools, and describe some next steps to put what works to create safe schools into practice. The recommendations from the Columbine Commission's review that took place in 2001 helped lay the groundwork for much of what we have learned and accomplished in school safety in Colorado and nationally. Those recommendations included the creation of crisis response plans and rehearsals. I just have to interrupt and say, Don Quick is just walking in right now. Hi, Don. Okay. He missed my opening remarks that were special for him. But anyway, okay. So the first things are that we've accomplished is rehearsals and crisis response plans, like we heard from Frank. The I Love You Guys Foundation has created a standard response protocol that is in 1,500 out of 1,800 Colorado schools. There's I Love You Guys, I'm gonna have to smile at them. Okay, and it's in 25,000 schools across the nation. We've created threat assessment teams, and we've done an amazing job in that. We've heard a little bit about that this morning. Districts like Adams 12, Jeffco, Douglas County, and Durango have been leaders in taking what we know works the best in threat assessment and implementing it in their districts, really being pioneers. And of course, our Colorado School Safety Resource Center is taking that training, so that cutting edge training that people are practicing in their schools, and they're training schools all over the state in threat assessment. So that's really good. And then we've heard also about Safe to Tell. In Colorado, we have Safe to Tell, which was started in 2004. Susan Payne, I can see you, okay, is the founder of Safe to Tell, and that came out of the Columbine Review Commission. We've heard some of the stats already on Safe to Tell, and they're just absolutely amazing. So, shortly after Columbine, the U.S. Secret Service and the Department of Education conducted a study of 37 school shootings that occurred in the United States between 1974 and 2000. And what they found is that 81% of the attackers told someone about their plan, and 93% of the attackers exhibited warning signs. So some of the signs include, writing down their plans, stockpiling weapons, really tangible signs that other people could see. So these same findings that we saw in these 37 cases show up as patterns over multiple mass shootings. These are not random acts of violence, they're carefully planned. The findings that others knew about the potential for an attack and saw warning signs taught us the painful lesson that there is an opportunity to intervene. In 2016, Dr. Sarah Goodrum and Bill Woodward, who work with our center, completed a comprehensive study that examined the events that led up to the Arapahoe High School shooting that happened in Centennial, Colorado, which left 2 students dead. They identified 3 major areas of concern related to information sharing, threat assessment, and leadership, school climate, and culture. In their report, they created a timeline of the events leading up to the shooting and identified 27 missed opportunities to intervene with the student of concern. The missed opportunities at Arapahoe were the same types of missed opportunities that emerged 20 years ago at Columbine, 11 years ago at Virginia Tech, and last year at Parkland. The pattern of events and circumstances leading up to each of these tragic school shootings are the same. People knew something was wrong, but they didn't know who to tell, how to tell them, or how to evaluate and support the troubled student. So this is the good news. We know a lot from research about what matters most to create safe schools. We really do. There's a lot of hope in what we have learned. And first, what matters most is moving upstream. Moving upstream and being proactive to prevent a young person from ever engaging in violence in the first place. So we want to do, like Deborah talked about this morning, we want to address the issues of those hurting kids so that they never want to have a weapon for criminal reasons. Second, creating and maintaining a positive school climate. And third, identifying and addressing warning signs. And I'm going to cover each of these in more depth in just a few minutes. Okay, so our center gets a lot of calls from the media after mass violence. And in December 2012, I was trying to pull together what I could possibly say to the media after the Sandy Hook Elementary School shooting. in which 20 first graders and 6 adults were killed. And I was sitting in my living room on that Sunday evening when the president was on TV. I was watching the grieving families, the grieving community, and I was holding the Surgeon General's report because I'm like, what do I possibly say? And I often use this report as a reference. Dr. Del Elliott, our center's founder, was the scientific editor, and within this report, there's lots of great information. But on this day, I decided to read the letters at the beginning, and I wanted to see what were the leaders telling us. This was written in 2001, and this is a quote from the Surgeon General, so it was Dr. David Satcher at that time. And what he wrote, he said, as a nation, we possess the knowledge and have translated that knowledge into programs that are unequivocally effective in preventing much serious youth violence. A registry of these programs can be found on the Blueprints for Healthy Youth Development website, which was supposed to be on there. So look at, it didn't end up on the slide, but Google Blueprints for Healthy Youth Development, and there's people here from Blueprints as well, because it's a really great resource on those programs. But we know the most upstream programs for violence prevention start before children are even born. For example, the Nurse Family Partnership Program works with first-time mothers when they're pregnant until their baby's 2 years old. And that program has demonstrated long-term impacts on crime and violence. Prevention makes sense. If we used what we know works to prevent violence, we could reduce violence by 30%. But because of many barriers, only 8% of violence prevention programs implemented in the schools in the US meet a research base. And of those programs and in those schools that are using the research-based standard, only 44% of those programs are implemented well. They're implemented as they're designed to be implemented. So although we know what works to prevent violence, we struggle to overcome barriers when putting what we know works into practice. So in my work, which has been a long time, like 25 years of working with schools and communities, I just kind of use the term flooded to talk about what it feels like when you're working in a school and you're asked to focus on prevention, or you're working in a community and just bombarded with so many issues and asked to focus on prevention. But in 2013, when Colorado was flooded in September 2013, I actually got to experience what that feels like for myself. I had 3 feet of water in my basement, and I was home alone, so I didn't have any help. And that night, I just felt completely overwhelmed and helpless, and I realized, whoa, I didn't even realize what flooded meant. You know, I didn't even really know what flooded meant until I was flooded. And that wasn't even the worst of the flood. I mean, I was fine. It was just 3 feet of water. Okay, so then in the Houston flood, I heard a woman talk about what flooded meant to her. So the floods in 2017. She described the experience this way: today is all we can comprehend, right now, barely. So when we are overwhelmed and anxious and uptight, what happens to us, and this is like a biological thing, we narrow in and focus and just get done what needs to get done right in front of us. And schools may not always be in the level of crisis of a flood, but they have to deal with a lot of stress every single day. My colleague Rona Walensky, who's the director of mindfulness at PassageWorks, recently wrote, "Ask an educator how you are doing, and the answers you are most likely to get speak of overwhelm, stress, exhaustion, just hanging on." A report from the Robert Wood Johnson Foundation states, high levels of stress are affecting teacher health and well-being, causing teacher burnout, lack of engagement, job dissatisfaction, and some of the highest turnover rates ever. So you can imagine, how do you focus on upstream proactive prevention when you feel as if you're in a flood? It's quite difficult. But what ultimately helped me most in the flood was my neighbor Bill. My neighbor Bill came over and he became like a superhero. mean, truly a superhero. So I've never done anything like this before, and I'm not great in emergencies, so it's way better I work in prevention, because there was this crackling sound of water in my, like it was crackling and electricity and in the water in the basement in the flood. And I'm like, I think you can get electrocuted if you walk into that water when there's electricity flowing. So I didn't go down there, but Bill turned off the breaker, and then we went downstairs, and then he started to carry up for the next hour all my most precious items that I asked him to carry up. So if we want our schools to implement upstream prevention, we must provide support and resources. And that means supports to pay for the programs and to pay for their effective implementation. And for the people who are going to coordinate all the effective implementation, it's a lot of work. If you've ever been one of those people, which I have, so I can say that out loud. So, and I'm not able to go into this too much right now, but if you'd like to learn more about this, we have like a resource list at our table at the CSPV table, and there's also an article that Rona and I wrote together that's listed at the bottom of the slide. So moving upstream includes both intervention and prevention. So intervention is where we wait until a kid is, hopefully not quite drowning, but they're in trouble, and then we throw them the life preserver. And we have tested really effective programs that work for intervention. We can throw them that life preserver and they can get help. But prevention actually gives kids the life vest. And even better, it teaches kids how to swim. So I have to kind of do that. Okay, it teaches kids how to swim. And what we can do is we can be putting social emotional learning programs in our preschools and in our elementary schools. In middle school, kids can get an effective life skills program. And in high school, they can be doing service learning, having opportunities in their community to engage. But too often, the resources are not there to pay for these programs, or they're only there as part of a short-term grant that's going to go away in a couple years. They're not embedded into the community, into the long-term institutions of the communities. And this is especially true in communities that have been under-resourced, really true in those communities. We need an infrastructure of prevention and intervention supports that doesn't go away. These supports need to be a sustained part of our public safety strategy. So moving upstream, this is the slide that prevention makes sense, the sense with a C. And what you can see here in this slide is that the intervention programs throwing the life preserver have a return on investment, but the return on investment is not as big as the return on investment on the prevention programs. And we also know that the estimated value of saving a single high-risk youth from a life of crime ranges from $2.6 to $5.3 million. So we can save the money if we go upstream and fund these programs. Okay, this is the second key area that we know works from research, and that is a positive school climate. So the U.S. Secret Service recommends we create cultures and climates of safety, respect, and emotional support in schools. So why does this matter for school safety? We know that the school climate affects whether bystanders come forward with information that's related to a threat or safety concern. Student bystanders who come forward report that they have at least one trusted adult in their school, and that they really believe that their safety concern will be addressed and listened to. The students who are reluctant to come forward, they don't think that their school is going to respond in a positive way. School climate also affects our healthy development. So negative environments have negative impacts. We know that kids can't learn as well if they don't feel safe. So culture and climate is the water that we swim in. It is the air that we breathe. It's created in every single interaction, and we all have a part in creating the culture and climate of our environments. My middle school in the early 1980s was an example of a negative climate. I was the smallest girl in my class, and I was bullied almost every single day in my 7th grade science class. I never told anyone. I failed math that year, and that experience had long-term negative consequences on my life. I have lived firsthand the detrimental effects of a negative environment, and an environment that's not safe for kids. My daughter's school climate, when she was in middle school here in Colorado in the early 2000s, was an awesome illustration of a positive school climate. All her teachers knew her well. She was challenged to her learning edge and supported and seen truly as her authentic self by her teachers and friends. So school climate is complex, and it's made up of multiple dimensions. We're going to have a whole presentation on that this afternoon. But what I want to say here is school climate can be measured. And since Columbine, we have recommended, our center has recommended that schools measure their climate annually using a school climate survey. And again, our website has examples of school climate surveys. So there's lots of great tools out there in terms of being able to measure school climate. You don't have to use our tool. There's many different excellent climate measures. But ideally then, the results of the climate survey are then shared with the whole school and used to set safety goals and priorities, and to measure whether the activities the school is doing, to address their climate needs, if they're working or not. So this is the great thing. It's not abstract. We can actually measure and test what we're doing with a climate survey. So the third area that matters most to create safe schools is identifying and addressing the warning signs. And there's 3 areas under here that I'm going to cover, and each of these areas I just tend to call them the foundational areas of school safety. And the first is bystander response and reporting, which we've already been hearing about. So we need to make sure that everyone, students, staff, parents, community members, is trained in the warning signs for violence and other mental health concerns, and also trained in how to report those concerns. So we want to make sure, what we've seen in Colorado is that we'll put posters on the wall, or we have badges with information about Safe to Tell on the student name badges, which is good. We want to have that, but we know that a poster on the wall is not enough training. The students need to actually practice and rehearse, really know what to do. The second critical area has to do with information sharing, and knowing the red flags and warning signs for violence proves to be limiting if schools officials and others do not have a system for sharing information about those red flags. And I can tell you, I have to look straight at Don Quick right now as I say this, that information sharing is extremely challenging. It is a very hard, but it's necessary. And this is why, because an escalation in the patterns of problem behavior, they don't develop like in 3 days. It can happen over weeks, over months, and over years. And many different people have access to that information, and it's in many different places. So having a really good system is very important. And with the kinds of technology that we have today, I think we can create a really, really good information sharing system. So that's a call to action. And I also want to say that there's also many misconceptions about what can or can't be shared. And the former Attorney General, Cynthia Kaufman, released an opinion paper 15 months ago to clarify those misconceptions. And in this paper, she says, schools have a duty to share safety-related information, and educators can and should share on the side of safety. The third foundational area is threat assessment and management. And schools, I know in Colorado and I believe across the nation, are really making great progress in this area. They're having a multidisciplinary threat assessment team. They're using the guidelines that were presented in the Secret Service. They're making great headway. And so we want to, like I said, we want to make sure that keeps going, and that we also want to make sure that the threat assessment systems are, the quality and fidelity of those threat assessment systems is monitored. So as you can hear from my presentation, these solutions are not simple, and there is no quick fix or magic formula to create safe schools. Using a comprehensive public health approach puts all these pieces together to address what matters most to create safe schools. So it's about moving upstream for prevention and intervention using effective programs, focusing on positive school climate and measuring school climate, identifying and addressing the warning signs, and of course, including implementation supports along the way. Our Safe Communities, Safe Schools model that our center developed right after Columbine is an example of a comprehensive approach to school safety that's designed to be feasible and actionable. And as was mentioned, it's currently being implemented in 44 middle schools in Colorado, funded by the National Institute of Justice. And our Safe Communities, Safe Schools model is recommended in the Attorney General's School Safety Guide. We're working now on how to share the processes of what we are doing with Safe Communities, Safe Schools, with schools in Colorado and nationally. And I do want to say, just our preliminary findings, we are seeing that the Safe Communities, Safe Schools actually improves schools' motivation and capacity to address safety concerns. So next steps, we can see upstream prevention's complex and difficult, and it often gets left out of the discussion on school safety. If we want to change these tragic outcomes, we really need to put prevention front and center. And we're starting to work with partners to develop something that we're calling a standard prevention protocol that's very much like the standard response protocol that's being implemented in 25,000 schools. So we think we can do something like that with prevention. We're very excited about that. The protocol would include those foundational areas I just covered, and the best practices. And what we want to do is invite partners from research and practice, and also the best, most creative minds. And that includes the minds of young people who can tell us how to make this information all make sense. We really want young people at the table with us as we develop the standard prevention protocol together. So we've come very far in the past 20 years. We have made drastic improvements in crisis response, and we must continue these efforts. But let us use these next 20 years to prevent violence from occurring in the first place. So before I end, I want to go back to the concept of climate. I talked to you about school climate and how it's created in every single interaction. But we know that climate isn't just in schools. It is in our workplaces and our businesses. It is at our family dinner tables and holiday gatherings. It is at soccer practice and in the gym. And how we choose to show up in each of these settings matters. May we commit to practicing deep listening and loving speech with each other and within ourselves. May we realize that taking these small steps are taking big steps. There is great hope. Really, together we can do this. Yay! Thank you.
This. So that was terrific. I have, as usual, some changes to the program. So we're going to do Q&A now, then we'll break for lunch. Art from Ashes will have a performance to start the afternoon rather than having the Art from Ashes performance now. And we're going to do a few minutes worth of Q&A here. And while I let you guys start to, oops, this needs to be, there we go. So this will allow you to do the same thing we did before, where you can send in questions. And while we're waiting for that, Mark, I wonder, I'd say I was struck because my career has been in HIV care, and I started in the 80s, and through the 90s, there were over 10,000 people a year dying of HIV in our country alone. And you put up the data from 2017, and there were 91 people who died. So that $25 million bought us a lot in terms of improved care and management of patients with HIV, without curing it, by the way. But we've done a lot with that money. So, and that money came in large part because of activism, right? ACT UP and groups that saw the carnage and said, this cannot stand. And of course, those were adults largely. And the people we're talking about are mostly kids who have a little less political influence, at least until the last year. What is the role of activism in bringing the budget to where it ought to be? And what ought the budget to be?
Well, I don't know what the budget should be, but a lot more than it is. I could see, I don't see why we couldn't identify $100 million to start addressing this issue. I mean, I think the kids' lives are certainly worth that. I agree that in terms of activism, 90% of the American public supports some kind of, what is it called, where you, dang, this is what happens when you get old. But it supports, you know, having a waiting period for purchasing guts. Thank you. I found it. 90% support that, and yet we don't have a national effort to do that. We don't have a national database that could be searched. Those kinds of things are relatively easy to change, and I think we're either afraid of the lobby who would not want any of that, or we're just not speaking up. I think I did some community organizing when I was in college, and major community organizing. They were cutting all these programs on campus, and so we organized the students to not cut those programs. And all those programs are the ones that people fought for in the previous 5 years, like women's studies, African American studies, bilingual studies, those kinds of programs. They were slashing and cutting them back, and we said, wait. The whole reason we wanted to do that is for the future. And to make a more equitable society. And one of the things I learned was that data spoke to power, that somehow, you know, when the kids, us, were, you know, talking and trying to say why these programs are important, the adults would, the people in power would sort of throw out all this data. And of course, then I was stymied saying, well, I don't have any data to kind of counter that, and then that's what motivated me to get a PhD, and now I'm just a data nerd. So I would say we need translators. I mean, I am certainly working on that in my own life, but I think as researchers we have to help translate research into action and work with the people who really know how to organize and who spend their lives doing that. But we need to be more partnered with them. So that we can try to make a difference. And one thing I didn't say is we're not talking about in the firearm work that we're doing. We're not talking about taking people's guns away. We're talking about helping make them safer. We didn't take cars away from people. We made them safer, and we can do the same thing with firearms. So I think that's, I don't know, I think that's what it takes. You know, every time we have a mass shooting, that makes the news, but we have a slow drip in many of our places of these things that we're not really paying attention to, and maybe we need to keep our foot on the gas, to use a metaphor, and it also surprises me that Columbine happens, we move a little bit. Parkland happens, or Newtown happens, we move a little bit. Parkland happens, we move a little bit, but we need to move more. The shootings that happened in New Zealand, they immediately had a federal law. There were shootings that happened in Tasmania and Australia outlawed and everything but long guns. We can do it in the United States if we had the will to do it, and we just have to not be afraid of doing the right thing.
Beverly, we've had a couple of questions that I think are a nice follow-on to that about the role of partnerships and collaboration. I wonder if you want to talk about what are the strategies that your center has and that others have, both to create partnerships with necessary stakeholders and to collaborate across the various centers that are doing this kind of work around the country.
That's a big question. It's a great question. So I think one of the issues in this, really, I can't talk about almost collaboration without talking some about funding, because there's not an infrastructure for prevention, and we're all collaborating across, national, state, local, but we are doing it sort of as like live or side jobs. We don't have, there's not time necessarily carved out for some of that work, and I think that that's a problem, especially when we're talking about really trying to get on the ground, working with schools. They're kind of in a flood, and so then they don't necessarily, I'm sure it's hard for them to even be here today because they're in school, having to be there in the buildings, to take the time out to understand what we need to be doing in prevention. So the second point I think I want to make about the collaboration is that it needs to be strategic. And so really, this is where the research can come along with the practitioners, so that we're making sure that we're collaborating on the right stuff. There was a term that I have a friend who coined, I use this word often, called collabobabble. And it's collaboration that didn't go right. Where you're having the same meeting, the Groundhog Day meeting, over and over again. And that's that's the kind we don't want to have. So I think we know enough of what to do that we can have some really strong, effective collaboration.
I see hashtag collabobabble trending on Twitter. Wonder if you could say where there have been a couple of questions about communities outside of school communities, and are there specific strategies? And in particular, I noticed at least one question, maybe more, asking about the roles of parents as sort of stakeholders at the margins of the school community, and how do you bring in folks who are not in the sort of usual suspects, people who are not in this room right now?
Okay. I know we both can talk about this question, and we love this question. Okay, I have the microphone. So this is an awesome question, because this we call our initiative Safe Communities, Safe Schools. That we coined that term after Columbine because we knew that this problem wasn't a school problem. It has to be the schools and communities coming together to address violence. And again, these same, we didn't get too into risk and protective factors, but the same risk and protective factors, we call it in research, the shared risk and protective factors, affect multiple problem behaviors, multiple outcomes. And so we can all come together strategically to do this work and to work upstream. Parents, business owners, I'll just give this, we have an example in one of our schools that a business owner who owns a coffee and a pie shop, he comes to the school planning team meetings, and they're doing the Alveus bullying prevention program in that school, and he's got the signs about, the I don't know what they're called, like the norms that they're trying to create in his coffee shop, and then he's trying to get other business owners involved in what they can do and creating safe spaces for kids and welcoming kids after school into their businesses. So there's just like endless examples, and the last thing I'll say about this, because I could talk about it for a really long time, is that in Colorado, we have Communities That Care. And Communities That Care is in 47 communities across Colorado. And communities that care could partner with schools that care, and we can all work together in a strategic way across the state. So I will continue to hold that vision and invite people to the table to continue the conversation.
I would just add, thinking ecologically about the different kinds of contexts, I think parents could be brought into this with, if they own guns, how they can make them safer. There's lock storage. I know that Eric is working on interventions, and we're working on work in emergency departments. When parents come in with their children, physicians can say, do you own a gun in the house? And if so, here's a free lock. Or do you know what are some of the strategies for keeping that safe? One way is keeping the bullets and the guns separate and locked separately. Another one is not having loaded guns in the house. But if you must, different ways of storing it. So there's physicians can play a role. It's not just criminal justice, it's not just a public health problem. And then also, the role that parents can play. I noticed a question in here that said, California, Illinois have some of the toughest gun restriction laws in the state, and they have among the highest rates of homicides in the country. And yeah, I'm not certain that, that is obviously not totally surprising. They have also large populations. The thing, again, and I said it before, I'll say it again, that's ecological. There isn't one solution. There was not one solution to get cars to be safer. It was to change our behavior. It was to make cars safer. It was to make roads safer. It was educational, and it was all of those things. Some of it was even improving emergency response so that people didn't necessarily die from the car crash itself. And we need to do all those things. So I think we need to do all those things as well. Like policies are not the only answer. They are part of the answer. They're not the only answer. So, I would just say, I guess that.
Yeah, well, I'm glad you went to that. That was going to be my next sort of highlighted question as well. And someone else mentioned why we haven't sort of highlighted the role of, because I brought up the role of advocates, but the NRA is an advocacy organization as well. And what is the role of the NRA and of the Parkland students and of the Columbine students today who are becoming very active in this arena? How do those advocacy organizations interplay?
Oh, I can just speak to that. In the FACTS group that we have organized, we actually have a stakeholder group of different organizations, national organizations, statewide organizations, police chiefs, and different stakeholders. We actually reached out. We didn't reach out to the NRA, but we reached out to another organization who's will remain nameless, but they were also a gun advocacy group. And the executive director said, "I'd be delighted to participate," and his board of directors said, "No way. We're not going to get close to that." Our group is totally open, and I think we have to sit down with them. I recently wrote something for, there's a media thing happening, and they asked me to write some stuff. So one of the things I said in this was that I mentioned the idea of fingerprinting, gun triggers that have your fingerprint, and only your fingerprint can shoot it. And one of the complaints that people have, especially those who are interested in, needing it and wanting it for their anxiety of being attacked or being needed to protect their family, whether or not that's a reasonable expectation or a reasonable, attitude, it is an attitude that exists, and that technology has to address that issue. And if it doesn't, it will never succeed. And I've seen people from the other side, if you will, write about there's no way we would ever want to use those because I don't want to have to fumble around with my gun and wonder if I'm going to be able to defend myself in time because my fingerprint isn't working. So I think we have to sit down with all groups at the table. Somehow in my lifetime, and it's a very sad thing, but somehow in my lifetime we've gotten to the point of where we could talk to people who had disagreeing points of view and come to some solutions to the point where we are now, where when you don't agree with each other, you just try to destroy the other group instead of sitting down and talking to them. And I speak specifically at the national level, but it's also happening at our local levels. I think at the end of the day, we have to talk to one another. Who was it, I think, who said it? Maybe it was Art from Ashes, who said, we have to start talking to each other. And that's the only way we're really going to solve some of these problems. So, and it was how we did it with the car industry, and how we did it with people who didn't want to buckle their seatbelt. Now everybody does. We have to change that norm, and we have to do it by talking to each other and listening to each other, and then trying to find common ground.
I wonder if one or both of you would like to address one of the questions that arose around school drills. In particular, I think that the questioner is trying to pull this into the climate conversation. And the question, I think this is a pretty provocative question, is conducting regular school drills around shooters contributing to a climate of safety, or does that create a climate that is potentially, destructive in some way to mental well-being? And I expect this is an area of active research, and what does the research say about this?
So I know a little about this research, but not a ton. But what I do know is that it actually matters what the climate of the school is that's conducting the drill. So in a school that is, the relationships are positive, the way the drill is conducted is, not threatening. It is done in a kind way. It's not, scary for the kids. It's explained. It's around safety. Then it doesn't have those harmful effects. So if that's what I would say is probably the essence of it, that it's about the delivery of the drill. And, probably more research needs to be done to really tease it all out. But I think that's what we know. You may know more.
I don't know anything. Okay. But let me just tell you, I really don't know anything about the research on this. Let me tell you two interesting stories.
We've brought the world's experts together.
Yeah, right. That particular thing, I don't know everything, even though my mother thinks I do, or says I think I do. Two quick things. One is I just learned from my 23-year-old daughter that when she was in elementary school, that they had drills of walking outside with their hands up. I was shocked. I didn't actually know it. They never told us. They never told us as parents that they were doing that. Surprising. But something. When I was growing up, we had drills for the nuclear bombs that were going to go off. And some of you who are my age might remember that. It was like duck and cover. And you were supposed to either go out in the hallway away from all the glass and put your head up against the wall and just wait. And I'm thinking then I always thought if it's a nuclear bomb, it's like, the other one was you duck and cover, you go under your desk. I'm thinking, go under your desk. I mean, even as a 10-year-old, I'm like, this is stupid. But when we're working with with the Sandy Hook Foundation in Miami, and we were talking to the police in Miami for their anonymous reporting system, and with their anonymous reporting system. And the chief of the school police at the time told me that you don't automatically send everybody outside. That's sometimes, what you're doing is you're setting up the kids to be exposed. So I found that to be absolutely fascinating. And I thought I never thought of that before. Sometimes you're better off locking yourself in the classroom and getting away from any windows in best you can, I guess. I mean, I'm not law enforcement, so I don't know. But I was surprised to hear that. So clearly there's different opinions. And whenever there's different opinions, then the data nerd would say, we need to do research on that.
So we have 1 minute left, and there's a bunch of really good questions. So I'm going to give you two to choose from, and you each get a last word. So one is around the level of intervention at the individual level. So using things like trauma-informed care for individuals at risk, the ACEs screening tool, which also designed to detect kids who are at risk. And what's the role for that sort of individual level screening? And the other question that I thought was quite provocative is the question of arming teachers and prevention through deterrence. So you could tackle one or the other, but probably not both in 1 minute. And then we'll break for lunch. So you are keeping people from lunch also. So that's going to.
Well, you're going first, so it'll be me who's keeping you from lunch.
Okay. But the first one was about individual level strategies. Okay, so I think that is such a great question and really, really important. So I did focus my presentation much more around climate and systems level, but at the individual level, we can also do screenings. Dr. Eric Siegel's probably right there. And he has a violence risk screening tool, which is amazing. That is a 14-item tool that you can use in schools, or you could use it as in the healthcare field as well, to screen for violence and predict future violence. It predicts future violence in 1 year later. And so that's then what the idea would be: you screen for violence or mental health concerns, and then you match kids. What I would like to see, we match kids to then the right resource to the right kid at the right time. That's a quote by Kevin West. And we use evidence-based programs, practices, and so that we match them to effective services. So that's my answer.
I wanted to touch the other one, but I'll just quickly say this is think ecologically, both and. Absolutely, we need to address individual issues, but we also need to think about the family, the community, the context, the climate, and the structural factors. And so we don't think about everything, we're only gonna make a small change. In terms of arming the schools, I'm gonna stick my neck out here and actually have an opinion. It's based on data. There's research actually that suggests that having a loaded gun in your house, you're more likely to be hurt by that gun, or one of your loved ones hurt by that gun, than you are to actually protect yourself. The attitudes notwithstanding, I have a cousin who's a physician, he's a pediatrician, affluent white guy, and he says, I'm never gonna, I leave a loaded gun in my house because I don't want anybody coming into my house without me taking care of him. And he was also ex-military, and it's like, he doesn't even know the data necessarily. And same thing with schools. If you think about when you were in school, you know, it was no matter where that gun was, kids will find it, first of all. I mean, you know, we always found it, stuff when we were, a locked drawer, a door in a classroom. I mean, you know, we snuck into rooms all the time and did stuff. It's kind of what you do, right? So that's a potential danger there. And then there's another danger, and that is when the police come in to help, how do they know who's who? Now, we did talk about last night that there is ID tags that you wear so you know who the teachers are and whatnot, but you know, from a distance, if somebody knows about those ID tags, is that relatively easy to counterfeit? And then you just don't know. And I think more guns just means more bullets being fired. It doesn't necessarily mean you're going to stop the problem. And the idea of hardening the targets, and if people will go to a soft target but not a hard target, I just don't know. I think we might need more research on that. But I have to say, I'm just not so sure that arming teachers is a great idea. Let me say one other thing, and that is, and I know there's some police officers in the audience, and I have fired a gun a little bit. And target practice. It was a rifle, long guns, and the target is, I don't know, 20 feet away, and they're little targets. See if you could spin it around and that kind of thing. I couldn't hit a darn thing. So I would need a lot of training to be able to hit the target I was aiming at. So if teachers are going to be armed, they need to be trained, and police officers kind of do ongoing training, I think, don't they? Ongoing training with the firearm, and then you put in the whole mix of it's an intensely emotional moment. I mean, you heard the principal talk earlier about how time just froze for him, and the fight and flight and fight reactions. It's not like the movies, and I just think it's a dangerous thing. Have a gun lunch.
Thank you so much. I will leave the important takeaway slide up so you can type in what you think is the most important takeaway. As I said, we're collecting all of these data this morning from the audience response system, so we'll appreciate that. Lunch is upstairs on the bridge. If you have a colored dot on your name tag, that's because you asked for a special lunch, and you need to go to the table to get that lunch. So to the registration table, and they'll direct you. We'll be back right sharp at 12:30.
Take a leg. Take a leg. That's all I do. Take a leg.
「 snow and winter's breeze, when eyes are closed, you will see. I had no time to write you a poem. I went too soon to write you a song. Left you some flowers, they've been here for hours. Next time I see you, there'll be so many more. I had no babes, water to feed them, couldn't wrap them up, so you'd be surprised. But when you get here and see how they sparkle, no star in the heavens could shine as bright. Purple, orange, red, and gold. Pretty painted petals, precious like the memories of when you held me through the snow and winter's breeze, when eyes are closed. Think of me in fields of swaying flowers, pretty painted flowers. Purple, orange, red, and gold. Pretty painted petals, precious like the memories of when you held me. Through the cold and winter's breeze, when eyes are closed, you will see sunshine through the cold and winter's breeze. When eyes are closed, you will see.
2, check. 2, 1, 2, check. Check, 1, 2. One, two, check. Check, check. 1, 2. Check, check. 1, 2, 1, 2. Check. Check, check. One, two, check. Check. 1, 2.
Don't pretend they'll be just fine without much of your time. Plan sweet things in advance. You may not get a second chance. Let them know what's on your mind. Be thoughtful, warm, and kind. Make certain that they know you love them so, and plan to stay, because you may not get someday. Foolishly, some way, wasting precious time. They'll learn too late that time won't wait, and love takes time. Live every day like it's your last, and when some years have passed, you're wise if you can say, love will lead us home someday. Live every day like it's your last, and when some years have passed, you're wise if you can say, when you start to pray, Lord, just have your way. Love will lead us home.
Testing. There we go. Hello, everyone. Welcome back from lunch. So, in the tradition of the symposium so far, we have some changes to the agenda. Congressman Crow is running a little late, so we're going to start with another student performance from Art from Ashes, and then we will get started on the panel discussion. We're going to try our best to convince the congressman to stick around for the Q&A with the panel, which would be taking advantage of the fact that he's running late. We'll see if we're able to do that. Otherwise, we'll have the panel and the congressman over the next hour. So let me start the session for the afternoon first by welcoming you back, and then by welcoming to the stage Carolyn, who is a lead facilitator from the Art from Ashes program, and she's going to introduce our next performer.
So I'm glad I'm wearing heels today, otherwise I wouldn't be able to see you. So in my time with Art from Ashes so far, I've been really lucky in being able to experience the results of giving these young people a place to share their voice and to share their story. Without fail, every time I show up, they're continually inspiring and their poems are moving. And listening to their work or seeing one of our young people just completely light up when one of our guest poets' words resonates with them is easily one of the happiest and most joyful parts of my week. So I'm thankful for this greater conversation today and for this opportunity that I get to share with you a little bit of what I get to experience every single week. So I'm going to introduce Janelle, who's one of our amazing young poets. She found Art from Ashes just by walking by and dropping in one day, and she has been with us ever since.
Hello. Oh my God. Okay. I don't really have a title for this, but it'll make sense after I read it. I live in a town where the wilderness doesn't need poetry. That's what the beginning quote would be. I live in a town where I grew up with fighters and bullies that my mom would have to yank me away from. I live in a town where all the neighbors would walk, as you walk by, are witnessing your every move. I live in a town where my mom was sick and couldn't care for me and could no longer be my shield from the world and its darkness. I live in a town where almost every night after slept in different houses without the comfort of my mom. I live in a town where I was taken advantage from and my mom not being on the earth anymore, and now she's gone. She left me to live with wolves and weasels that I'm supposed to call my family for the next 8 years of my life. I live in a town where I wish I could have said a proper goodbye to her. I live in a town where if I could turn back the hands of time, I would. I live in a town where now I encourage children from different homes with their mothers and fathers, but I wish that I didn't get to. I live in a town where If I get the opportunity to help somebody else, I will. I'll remind them to love their parents and cherish them for as long as they can. Thank you.
So fortunately, I don't have to follow that. Instead, I'm going to invite to the podium Sarah Goodrum. Sarah is Associate Professor of Criminal Justice and Chair of the Criminal Justice Department at the University of Northern Colorado. She has more than 16 years of experience conducting research on victimization, intimate partner abuse, and the criminal justice system, and examining violence in school settings. And we're very pleased to have her facilitate the afternoon's first discussion with our expert panel. Sarah.
Good afternoon. We're going to be hearing next from Christopher Nelson and David Osher, talking about learning from multiple perspectives and experiences to create cultures and climates of safety. After their presentations, we'll be taking questions using the texting system you've been seeing. So I first welcome Dr. Christopher Nelson, Senior Political Scientist from RAND Corporation.
Okay, well, thank you very much. Thank you for inviting me to share this special and exciting day with you. So Beverly, I was intrigued to learn that I'm not the only one who has a checkered academic past. You mentioned failing math. I got a D-, and I really should have failed by all rights. So for any students out there who are struggling, you know, it does get better. So. I want to share some lessons from a field that I've been deeply engaged in for 14 or so years, public health emergency preparedness. Before I do that, I just want to tell you a little bit more about where I'm coming from. First of all, the organization that I work for, RAND. If anybody is a fan of the movie Dr. Strangelove, you might remember some oblique references to it. So it kind of has a bit of a reputation, so I thought I'd just tell you what it is. So it's sort of a kind of an odd creature. It's part university, and in fact, we do have a fully accredited graduate degree in public policy. It's also a consultancy in that we do a lot of high impact or hopefully high impact work with decision makers and clients, policy think tank, and I see my graphic got a little bit skewed here, but you get the idea. So I've been there about 16 years, and you know, life is sometimes strange. I think somebody made reference to school safety had found him rather than him finding it. For public health preparedness, that's the way it was for me. When I started my career at RAND, I was doing research on school reform, particularly charter schools and school choice, and a little bit of work on workplace safety and health. And then, of course, 9/11 happened. And I think perhaps the most memorable images from 9/11, of course, are the airplanes crashing into the Twin Towers and other places. But you might also remember the next month, during October 11th, we had the anthrax incidents in Florida and the Northeast as well. And so in some ways that was the beginning of, or sort of the rebirth of a field that's been come to known as public health emergency preparedness. And in a nutshell, this is the health consequences, including mental health consequences associated with disasters, bioterrorism, earthquakes, anything you can imagine like that. And of course, this is nothing new. I mean, even biowarfare, if you read the ancient Greek historians, there was talk of taking people who were infected with diseases and sneaking them into other cities. So it's really nothing new in some ways. But I think there was a certain complacency that had evolved after the discovery and the wide availability of antibiotics. So we just didn't see these massive outbreaks at the same level that we had become accustomed to. And so this system was in many ways not prepared for these new threats, kind of the latest versions of bioterrorism threat, the increase in the risk of infectious diseases related to climate change, urbanization, increased global traveling, and things of that nature. So we had this challenge, but on the other hand, it was falling upon a system that the Institute of Medicine characterized in 1988 as in disarray, and then again in 2002, I think it was, as still in disarray. And so this has been a question for the public health system ever since. Can we retool the existing systems that we have? Can we evolve in that direction, or do we really require a revolution of some kind? Obviously, revolutions are difficult, but a number of us posed that question back in 2005 or thereabouts. And so, you know, there are some very important questions that I think have been threading through today's conversations. First of all, who and what is included in the system? So with school safety, clearly it's more than just the school, it's more than governmental education system, but who? Who's responsible? Who pays for it? How can this effort be sustained so that we're not constantly in sort of this incident attention cycle where we react and then followed by complacency? So these are all questions that the public health system has been wrestling with at least since the anthrax attacks of 2001, and I think it's fair to say school safety to some extent is dealing with. So I want to share very briefly just a few themes, a few lessons, and I think the first two I think are largely going to be just confirming things that have already been said. And so I think one of my takeaways from today as someone who is sort of coming at this a bit from the outside is there are a lot of common core principles, a lot of fundamental Lego building blocks, if you will, that really cut across these different scenarios. And so beginning with systems, first of all, we need to understand the systems that generate the risks. And so, and it's kind of a classic iceberg problem. We tend to focus on the part above the iceberg, which is something bad happened. It might be an outbreak of Ebola in Central Africa. It might be a foodborne, a hepatitis A outbreak in Pennsylvania, whatever the case may be. But of course, we need to develop the eyes, the mindset, the analytic tools to see behind that. What we tend to focus most on are the threats. And so in the school safety, it might be the individual with the gun. In infectious diseases, it's some kind of microbe, it might be a chemical spill. But as risk analysts continually remind us, risk is a function not just of threat, but of also of vulnerability. And so for just to take a very simple example, think of a river that floods onto an empty plain. Is that a disaster? You know, nobody there, not much agriculture to speak of. Is that a disaster? Well, maybe, maybe not. If a river floods into a city, into a basement, for instance, back to Beverly's talk, that is, at least at a personal level, a disaster. And so we need to be thinking not only of the threats, the insults to systems, but also how resilient are those systems and what's at risk. And I recently had the privilege of co-leading an effort to develop a post-hurricane recovery plan for Puerto Rico. And I think we had to be very, very mindful of the importance of these vulnerabilities. And I won't try to cover all of this, but here is a list of things that were happening before the hurricane, and I imagine many of you read about this in the paper, that in many ways contributed to a lot of the effects of the storm. The cascading effects of losing the power infrastructure, which shuts down water oftentimes, communications, transport, and then finally resulted in, the estimates are about 3,000 deaths related to the storm in one way or another. So, now that said, as important as prevention is, of course, sometimes things do go wrong, and so we certainly need to be able to respond, and I'll talk a little bit about some things related to response in a couple of minutes. But we also need to be thinking, there should be another box in that last diagram, but we really need to recognize that the job really isn't done until we've reached a state of human recovery after an incident. This has been kind of an interesting evolution in federal doctrine in emergency and disaster preparedness. Early on, when I first got involved in the work, it was primarily about preparing to respond, so something bad has happened. What are we going to do about it? And then increasingly a focus on resilience. And so now community resilience is a term that you hear at public health conferences and in health departments quite commonly. And also, pardon me, also recovery as well. And in fact, this diagram is from a kind of a new piece of federal doctrine called the National Disaster Recovery Framework. And one of the reasons I want to mention that is I think it sort of underscores the importance of kind of high visibility national efforts, including developing doctrine and guidance, that really draw attention to aspects of risk that we may not naturally think about. And if you look at this diagram, I don't know if anybody has ever had the chance to swim in the ocean, this is sort of the wave after the wave after the wave. And so the idea is that a community and a set of response systems need to be prepared not just for the first wave, for mitigating and dealing with the consequences of the immediate insult to the community, but the intermediate and then finally the long-term wave. A lot of times these long-term waves show up in terms of mental health. And so there was a big uptick in suicides and other similar psychological issues in Puerto Rico in the months after the disaster. And in fact, many of the deaths, most of those 3,000 deaths came in the months after the disaster as people's access to needed routine medical care had been compromised. So it really is kind of a marathon. It's not simply that something goes wrong, you respond to it, and then you put the fire trucks back in the fire station or whatever the equivalent in public health would be. Second, relationships. And again, I think this is a theme that I think has come up in just about all of the conversations. When we start looking at risk and risk management in terms of these systems, we very quickly realize that in our federalist, small f, and our federalist distributed governance systems in the United States under the 10th Amendment, no one really owns all of the resources and the infrastructure to address these. And so that makes these relationships that much more important. I forget whether it was Beverly or somebody else showed kind of an equivalent of this diagram for school safety. This is a diagram of the public health preparedness system put together by the Institute of Medicine in 2008. And at the center is governmental public health, but largely playing a coordinating role and depending very much on all of these other systems, civil protection, the media, and you can read it for yourself. And so Matthew mentioned the usual suspects. What to me this suggests is that we need to think about the unusual suspects as well. The other thing that I think has become apparent to me over the years is that it's not simply, and David and I have been talking about this quite a bit, it's not simply about engaging people, it's about fostering a mindset of different people as members of a system. And that's something I'll touch on in a bit, and I think maybe David plans to touch on it as well. Understanding what other people do, understanding how what you do individually or organizationally fits into what others. So a very simple example of the multi-sectoral, co-produced nature of response. This is just a very simple graphic that shows some of the typical entities involved in delivering antibiotics or vaccines after either a biological attack or some sort of acute disease that requires medical countermeasures. And as you can see, public health shows up in a couple of those areas, but oftentimes it's non-public health. Public works, private sector, law enforcement, and many others. And you know, for just about any kind of scenario you can imagine, there could be a chart just like this. Another thing I wanted to point out is that these partnerships are important not simply when you're trying to muster a response, but they're important even for trying to make sense of what's going on. And I think that may have some relevance to school safety. In my business, we talk about situational awareness, which, you know, if you know the English language, just it's the two words, awareness of the situation. But that is often a collaborative effort. Often different partners have access to different pieces of data. So clinicians in the healthcare system oftentimes have important information about who's showing up in clinics complaining of systems, things that the health department may or may not have access to. Law enforcement may be seeing things. Teachers may be seeing things related to an influenza outbreak. And so even figuring out what's going on, what the facts on the ground are, is in many ways a matter of group collaboration. And I would say, I wish I could say that public health preparedness has figured this all out. I think this is just a continuing struggle. But I think one interesting model that has emerged, particularly in the last 4 or 5 years, is that of the healthcare coalition. And a healthcare coalition is a combination of clinical and also non-clinical entities that are available to provide healthcare during times of crisis or stress. The acronyms are a little hard to understand, but it might include dialysis clinics, hospices, public works, EMS, probably ought to include the school system in there, actually. So I wonder whether there are other models that are somewhat formalized in school safety that we could look at and learn from. One of the other things I did want to mention is one of the big challenges in the clinical healthcare system is that, a lot of our infrastructure is owned by non-governmental entities, whether it's churches and charities or by private corporations. And so, as you can imagine, sometimes there are profit motives. You have economic competitors who need to collaborate in these regional healthcare coalitions. But I think the track record is that in many cases, these coalitions have been somewhat successful in forging those types of relationships, either through formal memorandum of understanding or through interpersonal relationships. Another thing I wanted to mention, following up on partners, having partners around the table is very important, but you also need to make sure that they have the resources that they need. And so the stuff that we tend to focus most on are the very tangible things, like hiring staff, where you have the money to do it. Of course, that's often a problem. Plans, equipment, and technology. And in my business, we call that capacity. But on the other hand, having stuff doesn't guarantee that you can actually do things, that you can perform with that stuff. And so we talk a lot about capabilities. Capabilities are at the individual level, people who are competently trained in their skill, but also I like to think about ensemble capacity, the ability of people to work together as a team. A very important capability in public health, and I think in school safety as well, is public messaging, because the public, parents, voters, stakeholders are often important participants in the system, whether you want them to be or not. If they care about it, if they're engaged, and people definitely care about their kids and about their schools, they are partners, and so communicating is important. Communication is also a two-way street. It's not simply about pushing messages out. It's also about being prepared to respond to messages, both during crises and during routine operations. The problem with capabilities, not only are they difficult to measure, but they also, I like metaphors. I guess the artists have been talking about metaphors. It has a short shelf life. So, Twinkie has a frighteningly long shelf life. But I would say, the capabilities that I deal with in my business are more like the jug of milk. They need to be refreshed. They need to be refreshed as people forget what they were trained in. They need to be refreshed as there's turnover. I have to say that I still see the consequences in my work of the 2008 recession, where we saw a huge downsizing of the local public health workforce, downsizing to some extent of law enforcement, fire departments. And so as you have that turnover, you lose some of that mental software that makes these systems work. You also you lose some of those relationships, that sort of social capital that promotes some of these collaborations. Finally, mindset and learning. And I guess the longer I'm in this business, the more important I think this is. So first of all, culture. There has to be a willingness to discuss failures and gaps only. And that takes trust. I mean, we all have egos. We're human beings. And so that takes trust. The other thing it takes is the right balance of optimism and pessimism. I was raised in Minnesota, so I got a good, strong dose of pessimism, so I had to work on the other. But some safety scientists like to think of it as seeing the cloud behind the silver lining, to see that even when things are going well, there may be hazardous conditions or things going on that could create risk factors. And so you need a culture where you can bring that up without being accused of being the boy who cried wolf. And all of this, of course, the tone for this is often set by leaders. But culture really can't be understood separate from concrete practices that help people reinforce these cultures over time. And so there's a lot of talk about finding ways to reward people for doing after-action reviews or critical incident reviews that are self-critical. You know, a lot of barriers to that, but are there ways to reward that? Paying attention to sentinel events. So cases where, you know, nothing really bad happened, but there, you know, there's something going on with a kid or something in the school that just doesn't seem right. Or there's a pattern in my work of clinical cases that don't quite rise to the level of sounding the alarm bells, but just seem a little bit odd. So focusing on those. One of the ways that we've experimented with dealing with some of these cultural issues is through peer assessment. And so there's always something a little bit threatening when, you know, your bosses come to evaluate you, but we've actually had some success in pilot testing, having communities evaluate each other's responses to incidents. They have a certain street cred, there's a certain level of trust that I think wouldn't exist otherwise. And then critical incident reporting as well, so more formally capturing these kinds of sentinel events, these things that aren't quite at the level of serious emergencies or problems, but may well be on the road to those. So with that, I'm going to wrap it up. So again, systems, relationships, capabilities, mindset and learning, and this is me, and please do send me an email if you have any questions or comments. Thank you very much.
So we will get back to question and answer and to our second speaker in just a moment. But first, we have the honor today of welcoming Jason Crow, the recently elected congressman from Colorado's 6th District, where you are all seated today. Mr. Crow is an attorney from the Denver area who trained at our own Sturm College of Law at UC Denver. He served as a U.S. Army Ranger doing 3 tours in Iraq and Afghanistan, earning a Bronze Star, and I assume having some experience with after-action reports and lessons learned. So he has taken that experience and is now the vice chair of the Congressional Gun Violence Prevention Task Force. We're very pleased to have Congressman Crow join us today.
Thank you for that very nice introduction, and to thank you to all of you for being here. This is always so encouraging to me to see people coming together from different backgrounds, different disciplines to talk about this issue. And frankly, it's fairly new. Just in the last 2 years, we have seen momentum really rise and sustain itself around this issue in the public health crisis that is the gun violence crisis in America right now. And I applaud your leadership and everything that you all are doing to keep that conversation going and to bring people together to talk about this. I don't have to tell this group the impact that gun violence has had on our nation and our community. This Saturday will mark the 20th anniversary of the Columbine shooting. And I still vividly remember watching it on the TV and the horror that it represented, and thinking about how just out of ordinary that was. What I didn't know at the time, and what none of us knew at the time, was that that would start a very long and terrible journey for America, as the number and the severity of these shootings have just increased over that time. You know, over the last few years, I've spent a lot of time talking to people around the community, and I can tell you that not a week has gone by where a parent, a student, a teacher doesn't come up to me and tell me how this has impacted them, how they are now afraid to go to school or afraid to walk down the street because of the color of their skin, that they don't break down in tears in front of me and just plead for leadership on this issue. And it wasn't that long ago that my then 5-year-old daughter came home from school and said, "Daddy, I had to hide in a dark closet today in case a bad guy came for us." And I just started to think, and my wife started to think about the environment that we have now created in our communities. You know, the trauma that we are now creating for our children, and a generation of children that are not hiding under their desks because of fear of fallout, like many people grew up in during the Cold War, but rather those who are hiding in dark closets like my daughter, or bathrooms for the fear of active shooters. So this is a public health crisis that we have to address on all fronts. I believe very firmly that we have to do that. We have an obligation to pursue action where and when we can pursue it, and as bipartisan of a way as we can. That includes common sense gun violence legislation, it includes mental health, it includes engaging with educators and law enforcement to make sure they have the tools and the training and the resources available to address this issue. In fact, we know that Colorado has actually led on this. Not long after the Aurora Theater shooting, which also happened here in our community, the people demanded action, and the leadership of this state responded with common sense universal background checks. And in the time that those background checks have been passed, 2,000 people in just Colorado alone have been prevented from obtaining firearms because they are a danger to themselves or others. And these are people that would have been able to obtain firearms that would not have been able to obtain them, or that would have been able to obtain them before this law passed. And I was very proud that just a few months ago to be a part of the effort that passed a similar measure, H.R. 8, in the U.S. House of Representatives, to have universal background checks at the federal level as well, and we will continue to fight for that. But it also requires us to act at all levels and address the mental health and law enforcement component. That's why I'm proud to be a sponsor of the TAPS Act, and that's actually a bipartisan, you can clap for that. And this is a bipartisan effort to say, how can we come together and have behavioral-based threat assessments, training in our schools and our law enforcement. And I'm very proud to be working with folks on the other side of the aisle to do something that's common sense that I think will save lives. We're going to continue to work together on that. Also, the Stop School Violence Act to provide grants for training educators and students to prevent student violence. And also our very successful Safe to Tell program here in Colorado to make sure we're providing the funding for what has been a very successful program to provide reports, an outlet for reporting for students on suicide prevention and violence in schools. I am convinced that it has saved lives. And again, these are common sense things that we can make progress on, and we're going to continue to do that where and when we can. I also want to give recognition for the Center for the Study and Prevention of Violence and the Colorado School Safety Resource Center and the Colorado Firearm Safety Coalition. I was just meeting with the Colorado Firearm Safety Coalition last week, and this is a group of gun store owners and gun clubs and others who have come together and say, how can we provide resources to our customers? And how can we provide resources to people on our gun ranges to let them know what is available? If they or a family member are in crisis, how can we save lives and prevent suicide, which we know is about 2/3 of the gun violence deaths in America. So the will is there. The bipartisanship is there. There are people coming together who are unlikely allies. They're coming together because we are now at a point where everybody is being impacted by this public health crisis. So I thank you for keeping the conversation going, and I just urge you all to continue to lead on this and engage with folks who are unlikely allies. Because it is when we make that engagement and when we reach out and have the hard conversations that we actually make progress and can continue to save lives. So thank you very much. I look forward to working with all of you.
Thank you, David Osher. I'll get your slides queued up. All right, so back to our regularly scheduled programming.
First, I want to thank the congressman for doing the good work. And like other speakers, I'm honored to be here, and I really feel that we are all part of a community. I mean, that our work converges in different ways, and it's very, very important. And You know, a book that came out this year on creating safe, equitable, and engaging schools starts with a paragraph, and I'm thinking of your daughter, and I was thinking about my granddaughter. But basically, think about your first day in school and how you feel, and then think about what can happen, but also what sometimes doesn't happen. And for some young people who live in relatively safe circumstances, this is now starting to happen. For other young people who live in schools that are militarized, this is happening all the time. And I start here because part of my theme is that we can prevent violence. We can do it in the ways that you've heard from Bev and Mark and everybody else. And at the same time, we have to be aware of the fact that safety is more than that. Safety is feeling comfortable being in a classroom. It's not feeling comfortable being in a closet. And what we want for our schools and we want for our communities is those places where people can come together and develop mindsets together and learn together and thrive together. And that means using our best science. It means taking on the issues that you've heard today. And it also means being very attentive to the short and long-term consequences of our actions. And so when people talk about hardening schools as a solution, rather than really focusing on primary prevention, both promotion and prevention in the way Bev has talked about it, and early intervention. When they do that, they may not be thinking about the fact that safety is also about emotional safety. It's about physical safety. It's about identity safety. And in schools or in universities, it's also about intellectual safety. Learning's about risk-taking, pro-social risk-taking, but risk-taking. And what we want for our environments, in schools, in after-school programs, in families, in communities, is people experiencing all those aspects of safety. And we have to be very, very attentive to it. And let me also give one other public health story before I do, okay? So safety, even physical safety, has a long-term time limit as well. And I just saw it before in the great slide of recovery. And so I sometimes wonder, knowing the research on the pipeline to prison and the effect of disproportionate suspension and exclusionary discipline that I hope you take on children of color, and the fact that it leaves them to prisons, when every time I give blood and I go through the screening, they ask me if I've spent, I think it's 8 weeks in a juvenile facility. Are we keeping kids safe by doing things that end up pushing them out of school and pushing them into places where you would not want them to give blood and then bringing them home? And that is an unanticipated consequence and an unnecessary consequence of the ways in which we responded to the shootings in the 90s and the 80s and the Columbines. Not everybody. I mean, there's lots of wonderful research that has been done, lots of wonderful projects that have existed. We had the great fortune of supporting the federal Safe Supported Schools grants. There were 11 states that used school climate in the ways that Bev were talking about to try to do things that would prevent violence. And in all the states, we saw positive results. Similarly, we had the good fortune of supporting these Safe School, Healthy School Students initiatives that were a response to Columbine in part. And for more than a decade, when they were implemented well, they really did the sort of things that we want to prevent without having the types of consequences for my grandchildren and your daughter that we do not want to have. Okay, so now let me start moving through things. All right, so what do I do here? So first of all, some takeaways regarding safety. Safety has multiple dimensions, as I've said. Schools in terms of physical safety, particularly safety from being shot, are relatively safe places. You saw that in Mark's slide. They're also well positioned from a public health perspective to reduce the likelihood of aggression and violence. Now let's remember that in terms of bullying, schools are not an unlikely place where you can be bullied. But that is something that we could do a better job of preventing. Climate connectedness and cultural responsiveness provide conditions for learning, for safety, and for well-being. Schools can be made safer by developing a capacity to reduce the likelihood of aggression and violence, while also addressing student and staff needs for emotional, physical, and identity safety. And I would add, in terms of what Chris just talked about, and also their need for coherence. I mean, he talked about that things make sense, that we know we're in school together to be in school and learn together. And when we're trying to create safety, we know what we're doing together. And when we have early warning signs that we know about, we know what we do with them. There is that level of understanding and coherence that's very, very important. Safety has multiple dimensions, as I said, and that's a repeat, so let's go on. Okay. All right, here we go. Okay. There are early warning signs, as Bev said. We do have the ability to use threat assessment when we do it well to head off things. And interestingly, statewide in Virginia, where they've used the Virginia threat assessment protocol, we see a major reduction in discipline disparities. Because finally, when people look at the individual and ask behavioral questions and ask the other relevant questions, they have to make decisions that are based on those data and not just based on perceptions. And lastly, reactive, punitive, and hardening approaches have harmful effects which have been experienced and are experienced disproportionately. About 2 years ago, I had the great fortune of people coming to me and saying, David, we would like you, we'd actually pay you to end up with others looking across many, many sciences regarding how students learn and develop, and tell us where things cohere. And I want to share some of those things with you because they really have implications for our conversation today. Although risk factors matter, the key, and you just heard it from Chris, is net vulnerability. The key is also the ability to alter predicted trajectories. And I think what's really important is our history in terms of doing interventions epidemiologically in the behavioral sciences is we can see that risks are predictive for populations, but we're not looking at what happens if you alter responses. So A, you stop doing things that are harmful, like taking lots of kids who are antisocial and put them together in a room and see what happens. Okay, we can really accelerate that trajectory, okay? But it's also when we do the sort of good research, proven interventions that can make a difference. That malleability and neuroplasticity are the core to human development. People used to believe that it's all genetics. It's not genetics. Genetics are not unimportant. It's epigenetics. And epigenetics are a process of the way in which genes are expressed in reaction to environments. And the most important part of those environments is the relational part. The relation between a mom and a daughter. The relationship between a teacher and a student. The relationship between and among students. Social and emotional competencies can be developed. We used to think that people have these set personalities and they're fixed. Well, we do have dispositions, but because of neuroplasticity, we can create environments where even impulsive guys like I can become less impulsive. Not only resilience, but thriving is possible. And when we adopted 2 kids who came to us through the child welfare system, both 5, many years ago, the messages we got and we believed is what we had to do is give kids prosthetics so that they could survive. We wanted them to be able to survive and be resilient. I now have much more knowledge vetted by other people that we could actually set a higher bar. They could thrive. Cognitive and social and emotional processes and developments are interconnected at all levels, and they have co-influential relationships with social context. I'll explain that. But we have been for many, many years caught in a Cartesian logic, right? We have a brain, maybe now we know we have a mind, and then we have a body, they're separated. They are not. They're all interconnected. They work together, which is one of the reasons why you don't want kids cowering in closets if you want to have a learning environment. And it's also one of the reasons why, if you want young people to be able to learn the skills, including the things that will help them be less aggressive, you have to develop relationships with them where they do feel supported, so they'll listen to you. These things are all connected. Experiences and how we process them drive growth and change. I think it was really important when Deborah Prothero-Stitt this morning brought up issues of race and including the experience of young people of color in this society, because how you experience the police, even though there are lots of very good police, does affect how you experience police in schools. You don't just disconnect from these things. And people process things both individually and collectively. Context matters, and the influence of context in ecology can never be ignored. And I say this in two different ways. Number one, if you think about a bioecological model, and like from Bronfenbrenner, people can think of different levels. The levels are always connecting. When Deborah Prothero-Stitt showed us that slave-catching poster, that's real today in a microaggression that is experienced by a young person of color. It's not just an artifact from 1845. The history is present right now, and we have to be aware of it. And at the same time, there's an ecology of interventions that's part of the system. And in fact, and I love the stuff that Bev Center does, and it's not what I'm about to say Bev Center doesn't do, but people sometimes think that all they can do is go and pick evidence-based programs and plop them in place, and then you'll get great results. When in reality, there's an ecology of intervention, and you have to be aware of it. And too many good things can actually hurt or cancel each other out. We have to really be attentive to all those things that are going on in places. I said that, okay. I think we know this, so I'm just, okay. But here, I think, is key. The ability of adults to attune with children, to buffer stress, to support their cognitive, social, and emotional development is key to healthy development and addressing the impacts of, well, I tell you what, it's addressing the impacts of everything like violence in people's life and disconnection. I'll fix these before we go up. Okay. I was trying to fix the slides while I was listening to Bev, and I did not do a great job of multitasking. Okay. Two more big takeaways from the science of learning development. One, schools and communities are dynamic systems, which again is one of the reasons why Chris's points are really important. People are, and I was listening to Sue last night, our police officer who's going to be up soon, who's talking about the fact that people have to be making decisions in micro moments when things are always changing. That's the nature of schools, even when things are easy. But in stressful moments, they're much harder, which is one of the reasons why we really need to act preventively, and also why we need to build the social and emotional competencies and trust and relationships of people so that they can work together and they can adjust to things in these dynamic moments that are always changing. Okay, I've done that so we can go on. Okay, so now, among the things that can happen when we do it wrong, and I'm purposely using the word from health of an iatrogenic intervention, a well-intended intervention that hurts, is the amplification of problem behavior, school disengagement, development of negative identities, struggles over dignity. You know, when I was listening again to Deborah Prothero-Stitt, I'm a historical sociologist by training. Dueling is one of the ways in which males in aristocracy maintain their sense of honor. One of the things that happens when we take away from young people, male and female, their sense of dignity, and Richard Sennett and Jonathan Cobb, two sociologists, talked about that many, many years ago, is there are fights over it. And what we need to do is both give people alternative ways of handling their dignity. Howard Stevenson at the University of Pennsylvania provide scripts to African American young men about how can they encounter the police and maintain their sense of dignity and try not to get blown away. That's giving them a script. But what you also want to do is prevent there being fights over dignity in the first place, because what we want in school environments, what we want in community environments, is people feeling that they are respected. And if you are respected, you don't have to fight over that. Identity unsafety. I've heard it from student after student, particularly students of color. The conspiracies of silence that Bev talked about. If I think adults are capricious, if I don't trust them, why should I tell them anything? And the risk when we do it badly of criminalizing adolescents and creating a pipeline to prison. It doesn't mean that we can't do some of these things well, but we always have to be aware that these are very, very dangerous interventions. And we have to train people, and we have to have real good protocols, and we have to watch and count numbers to make sure that these things are not happening. Okay, so I think, how much time do I have? 10 minutes, great. Okay, so now we get graphics, very easy, okay. So this is sort of reinforcing a lot of the things that Bev told you about, because she was right, and she didn't bring me in for that, but I very much agree. One is in terms of the question that was asked before, you always want to address individual factors. You want to address them for two reasons. Number one, because all of us could get better, and in fact, addressing them does not mean that you just want to deal with needs. You also want to build strengths. But we are also a condition for each other, so that it's really important to develop my competencies so that I can interact with you better. Then what we want to do is address those people who are proximal, who are closest to the young person, the family, the teacher, the peers. Think about what's going on in the classroom. At the same time, we want to deal with the climate, and I'm going to talk a little about what are those key elements of the climate, and all those different things that happen in the community. And I'm bringing, this is a complement to Mark's presentation in the sense I'm focusing more on the school. But I think if we were talking about the community, I would end up having as part of the components of that community ecologically the school, because in the same way as Mark said, school stuff spins off into the community. But I can tell you in places, say in the Bronx, where you're living on the cusp of two gangs, community stuff spills over into the schools. Both of these go back and forth. In the work that I have been doing over many years, I've been thinking about what are those aspects of climate that are most related to people's ability to learn, to perform, to teach, to feel good, to attend, and to engage. And part of it is what I've heard about before, it's the experience of safety. Part of it is the experience of support and connection, of belonging, of feeling bonded to the school, of the experience of having positive peer relationships, of not only feeling supported, but knowing that effective and support is available. Once I was in Chicago, and I was at a school in North Lawndale, which is an area of Chicago that is known for its gangs, and also known for a lot of major important cultural things that are there. And I was in a school that Chicago had brought me because they had gone then 186 days without a fight. They've done a lot better. But the kids were also being academically much more challenged. And so knowing the research, I wanted to find out if they ever were challenged too much. And I said to them, you ever challenged too much? They said, no. And so I fed back and I said, wait a second, you already told me about this and this and this and this. How can you say you're not challenged? And what they said was, the teachers have our backs. Now, I can tell you about schools I know that work where teachers take risks as well, and they'll tell you that their fellow teachers have their backs. Having one's back and knowing that people have your back is really important if we're going to be able to succeed. It's really important if we're going to be able to develop problem-solving cultures. It's very important if you really want to develop collaborations that work. I mean, Chris and I were talking about collaborations before. Another one is not just having relational trust. It's also knowing if things go down, you're not going to throw me under the bus and walk away, that you will have my back because I have yours. The experience of challenge and engagement, high expectations, that you see as being relevant to yourself, having a strong personal motivation to be there, et cetera, et cetera. And being surrounded by people who are socially capable. Basically, both, we go back to that one slide, the ecological slide, my social and emotional and cognitive competencies are important to my success, but they affect each of you. And you affect me. That's the co-influential piece. And so we grow and swim together. We also drown together if we can't. Basically did a study for Robert Wood Johnson about 2 years ago, but basically what we found, and we didn't force feed this, is think about school climate, which is the blue, think about the social and emotional competencies that you can develop through social emotional learning, which are the light green. In between, there really is this Venn intersect. And this is important because people who are doing social emotional learning now are understanding the fact that it's learned within context. It's practiced within context. You don't just parachute in an SEL program and have people learn. People experience it. And when they're experiencing it in the ways that I've been talking about it. And if you want to see this stuff, go to Edutopia, edutopia.org, and look at the different short videos on the science of learning and development. And you'll see exactly how people are creating environments that help people be identity safe and at the same time help young people learn social and emotional competencies. We want to do this in that public health three-tiered manner using data. I think what's important that I would always urge is I see the universal tier as being foundational. And what is important is while probably, I don't know, I'm not a physician, so the public health people here can tell me where I'm going wrong. But I used to say, this is like putting fluoride in water. It is. But it's also thinking about the fact that in some communities, people have much higher levels of tooth decay. And you have to do something else to make sure it works. And so the notion that we have a typical foundation and it's going to work everywhere doesn't work. Because just as individuals are different, each context is different. And since people are a product of not just themselves, but the needs of the people around them, we really have to adjust the context. So when I work in Cleveland, which is a city that's been turning itself around in terms of its school system, and in part through using school climate data for now 10 years, but one of the things they know is that they really have to build into their system in every classroom in every school, trauma sensitivity. Why? Because almost every kid in that school system has grown up in chronic poverty. Why? Because of the fact that you have such rent instability in that city that people move, 1/3 of the students move each year. In that context, you have to act differently than if you were in a suburb of Denver. This comes from the Surgeon General's, not the Surgeon General, the IOM report of 2009, which was a redoing of the 1994 prevention of mental health, emotional, mental, and behavioral health, or whatever it was. And it was a really important document because they really talked about promotion and not just prevention. And I think you all know, but there's a difference between giving people portable resources that they can take and apply to other circumstances, and building the ecological resources that also that can support people, and also doing those things that will affect their behavior in particular places and can head off and prevent problems. And you need to do both, because we've seen good research, and I'm thinking of David Hawkins' work that really demonstrates the fact that all the assets in the world does not mean that you don't need to prevent. But on the other hand, all the prevention in the world cannot anticipate the new situations that people are going to encounter, where they're going to have to draw upon their own assets to figure things out. Anyway, to summarize that report as I and other people have read it is, you need to minimize the toxic conditions in schools. And that can include the different things that can create aggression and violence, including our mistaken responses to violence and aggression. You need to support the whole child, his wellness and health, as well as their social emotional development. You need to provide supportive conditions for social, emotional, and academic learning, and you need to promote emotional skills and psychological flexibility. And we need to do this all in a way that is culturally responsive and aware of the fact that there is an individuality to each of our own developing, even though it always is social. And so the logic that people talk about today of intersectionality is really important. And so people are both members of groups and are treated as members of groups, and also experience things in terms of their own individuality, in their own uniqueness, and we have to be able to address both. And when we're using data, we have to ultimately be able to understand the fact that we both no longer have to, and we no longer should just be satisfied with aggregate average data. Because we now have the ability through artificial intelligence and neural networks and much more sophisticated measurement systems to actually be able to get much closer to the individuality of development, and then to be able to see how those things come together in terms of the aggregate results that we're trying to address. Next to lastly, so what is the key? Part of it is effective conditions for learning and teaching. Part of it is that SEL development that Bev talked about. Part of it is addressing teacher and student well-being and competence. Climate can be measured. I'll just tell you from the work that we've done. And the first two are totally free. The federal government has a survey that was developed, suite of 4 surveys, produces data back in real life time, the feds don't collect it, benchmarked for teachers, for students, for other school staff, as well as for families. People often would say, can't afford to do this stuff. We can afford it. It's actually available right now. It was developed for the National Center for Educational Statistics, so this was done at the highest level of psychrometric value. And at the same time, the survey includes the ability to add items. You just can't subtract items, so that the psychometrics work. There's a survey that's freely available on the conditions for learning that I talked about. And that's the survey that Cleveland has used, among others, to turn itself around. And what they do is they take those data, they actually do the survey 2 times a year, have planning teams to really ask what they can do to improve outcomes based on those data. And in the case of Cleveland, teachers are incentivized in terms of their contract, and principals are held accountable for improvements on conditions for learning. There are other surveys. There's an Alaska School Climate Survey that we've been involved in for the last 15 years that is very effective. We work in Nevada statewide right now with an adaptation of the SCLS. There are lots of other surveys. Some are lousy or mediocre. A lot are good. If you want a place to get them, go to the National Center on Safe Supportive Learning Environments. I think it's safesupportive.gov, which is safesupportive.ed.gov, but I'll put it on here. It's a national center on those issues, and we're responsible for vetting surveys because I'm in the survey business, and part among other things, we don't do the vetting. We have a partner, Child Trends, that does the vetting. And my time is up, and so we're fine. So thank you very much, and I think we can now, I stay here, right? And we have questions. Okay.
Oh, here.
Let's do from here. That looks like that was the earlier panel. There we go.
All right, thank you. So a lot of what both Dr. Nelson and Dr. Osher addressed today talks about the way the system is functioning to address public health crises and prevent violence and promote safety. And I think that's one of the most challenging issues to address in both our society and in our school systems. So, and it was certainly something that came up in our investigation of the shooting that occurred at Arapahoe High School here in Colorado in 2013. Can you provide some tangible examples of how organizations or systems can go about building the teams and then addressing the problems with the system's current manner of functioning to improve safety, to improve social emotional skills?
I think I'm on. Yes? Okay. I mentioned Cleveland. So let me tell you about Cleveland, because Cleveland started with a shooting. Okay, in 2007. In 2007. Okay. Cleveland started with a shooting. In 2007, in November, actually the 7th day of the chief academic officer, who's now the school superintendent, there was a shooting. And the shooting traumatized the community, as in many cases. And Cleveland's first response was to bring in metal detectors. And at the same time, the then superintendent said, we have to address humanware. We cannot just rely on hardware. And they commissioned an audit, which I was fortunate enough to do, even though I initially turned it down because I was skeptical about what they were doing, but I had the good fortune of being persuaded. And the audit was actually to find out what the school and the community could do to prevent incidents like that in the future. It was coupled by another a security audit that we didn't do, that was done by the Council on Great City Schools that sent in people. And the mayor of the city had a public health mentality, even if he didn't speak public health. He said, I'm concerned about the health of my community. Students are in my community. I'm concerned about their health. I don't want them to be unsafe. And at the same time, what we said to them is, if you want us to do it, we'd like to build it around the conditions for learning, because you're not going to ultimately change schools if you just focus on safety, because that's not the only thing that schools are accountable for. If you really want to integrate the system, you have to do that. So we did an audit, and we did, we surveyed every school on conditions for learning, so we at least had some epidemiological data. And when it came to writing the recommendations, we recommended that they do 10 things, big things, over a 5-year period developmentally. And some of the people whom I worked with said, David, you can't do that. You have to tell people to pick 1 or 2 priorities and that's it. That's the way you get things done. And I pushed back and I said, given the nature of the needs in Cleveland, given the intractability of these issues, if you're going to really make a dent, it means addressing a panoply of issues that are connected. It is the system that Chris was talking about, and you have to do it developmentally. And in fact, Cleveland is now in the 10th year, has really continued to make progress, has not had another incident like the one that it had. And we made sure in the first year that that was made unlikely. So that was doubled down. But more importantly, it did it by developing the social and emotional competencies. And I'll give you one example at the end. So people may remember about 2 years ago, one of the many verdicts that Deborah Prothero talked about this morning, where a police officer ended up shooting a black student and then went to was found not guilty. In Baltimore, there were riots afterwards. In Cleveland, there were going to be 2 such cases. And a school superintendent assumed that what would happen, as did happen, would be that the officers would be found not guilty for very similar reasons. But what he did was he said, you know, we have been investing in social emotional learning for 5 years. What if we were to enable our young people to meet together before anything happens, to process what they might do, and to really talk about what they would do? And so all classes did it with the mandate to teachers that they facilitate the discussion, but not try to control the discussion. And you know, like any good prevention, we have no idea whether that worked. But what we do know was that young people in the city did not respond in the way in which they did respond in Baltimore. And the young people would say that, you know, they're thinking about it. They're thinking about it would make a difference. I think it's the mic too. Okay. Anyway, that was a long answer, but the answer is you can do it, but you really have to hold onto it. You have to operate in a 3-tiered manner and not think that any one thing like social emotional learning or mental health provision is important, and really attend to what Cleveland is still struggling with, which is quality of implementation across every school in every classroom.
All right. There we go. All right. I'm not accustomed to not being heard. Usually people tell me to speak less loudly. Just to build on what David said, I think ideally kind of taking kind of a comprehensive systems approach is ideal if the school is in a position to do that. On the other hand, I think, there is a lot of value in that critical incident. The worst case, of course, is the shooting, but all the better if you can be identifying some sentinel indicators, some leading indicators, and then that one event becomes sort of your window into the system. And so just some very, very simple things that I find helpful across systems. Draw pictures of it. What is the temporal cycle of events that you think preceded, whether it's a kid acting out in a fairly harmless way or a way that threatens self-harm or harm to others? What are the consequences? And then, who has leverage, who has the opportunity within the school, outside the school, to intervene on each of those? And so that can be a pretty quick way to kind of build that kind of that kind of culture of system thinking around a very specific event. And then the next thing you start asking, well, is this event really unique, or is this an example of something else? Is it like another one? And looking at infectious disease responses and industrial accidents and things like that, there often are these common Lego building blocks. They're combined in different ways, but look for the simple pieces that can get combined in different ways. Let
me just add 2 things. One, because Chris is right, and in fact, 2 of the major recommendations came from that type of incident review. One was the young person actually had been receiving services from 3 different community agencies that had not communicated with each other. The other was he was actually on the list for an assessment for additional services, but it was a special ed type of list and they kept on waiting rather than doing it. And so that ends up being very important. The other point I should have said is, and this is just quoting Cleveland's superintendent, is the metal detectors probably produced whatever changes took place before the humanware came into place, because of the fact that they did set a floor. But it was the human things that they were doing, including the active participation of the school police chief, who was very much in favor of all the work and in terms of training of his staff to make sure things worked well.
One of the questions that's come up a couple of times in the polling, it talks about more so maybe how an individual person within a system might address the environmental conditions where they're seeing aggression, disrespect, an unhealthy climate. How might, say, a teacher or a principal address that issue as an individual in an organization that does not appear to be functioning well?
I will take a quick stab at that, since I have not been working on schools directly for quite some time. Well, you know, I think some of the same steps that I was just mentioning aren't a bad place to start. So what are the specific things that you as the teacher are seeing? What are some of the precursors? And that might be a good window or a good opportunity to say, well, hey, you know, to your colleagues, to your leadership, that these are things that are happening outside my classroom. You know, not to put the blame, but this is, you know, kind of build that awareness of, you know, what goes on in my classroom depends, to some of David's comments, on what goes on in the broader school. What I'm doing affects what others are doing, and you know, kind of introducing that conversation around an event that gets people's attention. So that might be one place to start. But David?
I think that's right. What I would add is that one of the reasons I like surveys is that if they're done in a way that the items are behavioral and people are assured confidentiality, that gives you a picture. But I see a survey as like a screener. Then you can do focus groups with people and basically say, things like, how relevant is this to you? Please tell us more. And people will then tend to open up within that context, because the data that are collected already justify them in sharing information.
And it looks like our time is up. Yeah, thank you, guys.
So we have a 15-minute break. I believe there's coffee and maybe even cookies. Please rejoin us sharp at 2 p.m. We'll have the Attorney General of the state.
Take a leg. Take a leg. That's all I know. Take a leg.
2, Through the snow and winter's breeze, when eyes are closed, you will see. I had no time to write you a poem. I went too soon to write you a song. Left you some flowers, they've been here for hours. Next time I see you, there'll be so many more. I had no vase, no water to feed them. Couldn't wrap them up so you'd be surprised. But when you get here and see how they sparkle, no star in the heavens could shine as bright. Purple, orange, red, and gold. Pretty painted petals, precious like the memories of when you held me close through the snow and winter's breeze. When eyes are closed, think of me in fields of swaying flowers. Pretty painted flowers.
If there are folks who can rustle the people out in the atrium to come on back in, let's reconvene.
Well, welcome back, everyone. This session is entitled Moving Colorado Forward. And part of our purpose in this session will be to bring things together from an evidence-packed day. We've learned a lot. We're going to begin with our last and final poem performance from Art from Ashes. I've been asked to tell the audience this may be an R-rated presentation, but we're all adults, so I think this will be just fine. And Carolyn, let me ask you to come up and make the introductions, and thanks so much for coming.
So real quick before I introduce our next artist, I just wanted to mention that at the core of what we do as facilitators, and honestly everyone at Art from Ashes, is to ensure that young people know that what they have to say is valuable, and that poetry and art are incredibly powerful tools for them to tell their stories in a way that's productive and beautiful. And I know Catherine mentioned it this morning when she spoke, but young people want to be heard and they deserve to be heard. So I just wanted to say thank you to the University of Colorado. I was like, oh, I'm gonna mess it up and say an old one, for having us here today, and for all of you for giving our performers an opportunity to be heard. So we have next up Brandon, and he began with Art from Ashes at Endeavor Academy, which is one of our community partners, and he's been joining us at our weekly workshops and our performances ever since then. And his presence is so powerful and awesome to have in the way that he's willing to share and inspire other youth to open up and share. So take it away.
It's a lot of people. So I don't know if this was a censored audience or non-censored, so I asked prior, supposedly it's uncensored, so here we go. So the poem that this went with, we were basically, she was describing how certain metals are given alloys to make them stronger, and certain metals are weakened throughout time, say like water creates rust. And this poem basically is my view on life from freshman year when I started high school all the way up until senior year when I graduated. And yeah, so if it doesn't make sense, just a little prelude. All right. Life's a fucking trip, so when I fucking dip, got that grip on my hip. When I slip up in the pit, rip up my shit, let me spit. This metaphorical art, call me the oracle with no heart, the diabolical Mozart. I'm just waiting to depart from this plane and descend to what most call insane. Never claim what you can't back up, boy. Mary Jane or the racks never racked up. Fact up or back up, are you ready to get blasted? Shrooms and acid gave me massive philosophical glasses, overflowing this brain-filled casket. Take off the glasses and my brain was left feeling like molasses. The bloke me can never grasp this, made it to 19. How the fuck did this happen? As I'm blasting Ghostman in my veins with some suicide boys for the pain and Sequoia for the gains. Not to mention, Craigslist and Eminem. Gotta pay homage to the better men in my life. Kicking me out of my deep strife fucking knife. I got a mouse spitting bars like an automatic. Taking lines just to create something fucking tragic. Like my freshman year when cocaine ruined my nasal septum. This now vacant section with This now vacant section with an OCD collection of everything I mentioned. The tension in my mind was the coffin in disguise. Popping oxys and Vikes on Mike and Nikes to soothe the pain late at night. I took hikes with angelic psychedelics, making relics of everything I've seen. But shit, as I'm a clusterfuck with primordial knowledge, I gotta come clean. All these fractals and vivid hallucinations gave me a fixation on colors are just vibrations, so my self-mutilation was just the creation of colorful music. Tulips and elusive confusion. Every delusion about this self-made seclusion is just a gruesome execution of the ego I've tried to loosen. So who's in for another bruising, because I'm never losing the fusion that keeps me in unison with my ominous omnitrix. The obvious politics that keeps me different from all the other pricks.
Thanks. So I have the privilege of introducing the 38th and 39th Attorneys General of the state of Colorado. I learned about the power of the Attorney General's office for public health when I participated in the litigation of the Attorneys General in the states against the tobacco industry, dating back more than 20 years ago when I started with the state of Minnesota. One outcome of that was the master settlement agreement with the tobacco industry that is looked to by many as a potential solution for other problems, most recently the opioid problem and the drug manufacturers that produced these drugs. But the AG's office in Colorado has a long legacy of working on school safety, including action in response to Columbine. Columbine was followed by a statewide tour of schools by AG Ken Salazar and Dr. Del Elliott from the Center for the Study and Prevention of Violence. Now the AG's activities in this arena continued with many things to list, including managing the Safe to Tell reporting system that we've already heard about, recently developed in the Colorado School Safety Guide, and more. This is, of course, been continued under Cynthia Kaufman, who I'll be introducing, and now with our new Attorney General. Let me start by introducing the 38th Attorney General of Colorado, Cynthia Kaufman. She's originally from Missouri, came to Colorado, and had a lengthy legal career that began more than 25 years ago in the Georgia Attorney's General Office, working on the 1996 Centennial Olympic Games. You'll remember that there was a tragic episode of violence there, and at that time she served as the primary liaison with the victims and their families following the attack in Olympic Park. She began working here in Colorado and with the Colorado Department of Law in March of 2005 when she was appointed Chief Deputy Attorney General, was in that role, and then of course became the 38th Attorney General. 2016 roll call named Attorney General Kaufman one of the most influential women in state politics. In 2017, Law Week Colorado named her one of the top women attorneys. I spoke at the National Association of Attorneys General meeting in March, and I learned that the attorneys general are called general. So with that, let me welcome Attorney General Kaufman for her remarks. Thank you. Wait a minute, I'm getting instructions. Okay.
Thank you so much. Well, thank you all. It's so good to be with you. Thank you to CU for hosting us, and to our organizers and longtime friends in the School of Public Health, the Center for Bioethics and Humanities, and of course the Center for the Study and Prevention of Violence, who has been with us. We have worked together since 1999 through the Safe to Tell program that you have heard mentioned today, and the Safe Communities, Safe Schools initiative. And so it's fitting that on the 20th anniversary of the tragedy at Columbine High School, we come together to reflect, but also to look forward. And I appreciate being in the looking forward portion of the program. Though I am retired now from service, I have more time to look forward. In Colorado, we have had continuity throughout the tragedy that we have experienced. From Columbine to Platte Canyon, from Deer Creek to Youth with a Mission, and then Arapahoe High School, we have voices of inspiration like Frank DeAngelis, who you heard from this morning. We have voices of academia and research, Dr. Kingston, Dr. Samet, and we have voices of experience and practice, and they are going to be your panelists here in a few minutes. We have moved forward over these 20 years with training and education, with drills, with the creation of positive school environments, cultures, and climates. We have practiced and worked on prevention and protection, response, and recovery. And this conference, coming on the week of the 20th anniversary of the Columbine tragedy, to me provides us all with a timely opportunity to recommit ourselves in memory of those who were lost and in honor of those who survived that tragic shooting. Our governor is going to be doing that with his words on April 20th in observation of the Columbine Memorial and Anniversary. And he is going to be proclaiming it a day and a year of recommitment based on an observation and memorial to the victims of Columbine. And the fact that he is doing that from his position as governor, I think it says so much to us about what we can do and what I'm going to challenge you to do today. I think that we can do more to bring all of our disciplines together. I think we can unite our knowledge and our talents to do a better job of preventing school violence. And I think that people in this field, the people I work with, want tangible solutions because they are people of action. Now, you all know that action based on research and on experience is the most effective means to deter violence. And I challenge all of us to act on what we know. To leave this room today and think, what's one more thing that I can do to protect kids either in Colorado, in the state that you're from, or some of you are on the national front and can think about how to keep kids safe at the federal level. I think we're very fortunate that we have a new Attorney General who can help bridge the worlds that we all come from. As the Dean of the University of Colorado School of Law, Phil Weiser formed relationships and earned credibility that carries forward into his role as Attorney General. And his view and his commitment to keeping Colorado school children safe, to me, presents a unique opportunity, an exciting one for our state as we move forward. So I'm not sure I'm supposed to introduce my successor, but it just seems like perfect symmetry. So there, I just did it. Now, you may have more to say about that, Dr. Samet, but I am pleased to turn the podium over to my friend and colleague, Phil Weiser.
So I think our Attorney General is introduced. I'm just changing the slide. But please, thank you.
Thank you, Cynthia. Your leadership in this area is part of the legacy, and your staying engaged is an inspiration to me and should be to all of us, because what Cynthia now is she's a citizen and someone who cares about these issues. We all have to work together. This is not going to be an issue that we can say, can't we just stop thinking about it? 20 years ago, we weren't thinking about school shootings. Like many of you, most of you, I'll never forget when I heard about what had happened. And what all of us have to ask is, what can we do? So whether or not you hear the phrase, another Columbine, or another Virginia Tech, or Sandy Hook, or Arapahoe High School, or Parkland, we've gone from saying, how could this ever happen, to where and when will this happen next? Which means we have to be committed, as Cynthia put it, recommit to asking what are the steps that we can take. Because I've got a high schooler and I've got a middle schooler. These issues are deeply personal to all of us who are aware that our kids are growing up in a world that's different from the world that we grew up in. And we've got to ask, what are the tools that we can develop as educators, as law enforcers, as public health professionals? Let me talk a little bit about what we're doing, what we can do, and how we can do it together. First, we've got to work hard on developing a climate where people can feel safe, which means bullying is often a precursor to people feeling intimidated, feeling threatened, developing vendettas, which plays itself out in all sorts of dangerous ways. We need to have more climate surveys in schools. And this is why a tool that's been designed by the University of Colorado Center for the Study and Prevention of Violence, School Climate Survey, is so important. By using this tool and by developing the Colorado Healthy Kids Survey, we can better assess the extent of bullying, mental health issues, use of substances, all of which can undermine a healthy environment. If schools can then figure out ways to create partnerships with law enforcement, as threats emerge, they can be acted on. And this is where Safe to Tell comes in. This was one of the learnings that came out of Columbine, and for places like Parkland, they had to relearn this experience. And founder of Safe to Tell, Susan Payne, has traveled to many places asking how can we learn from Safe to Tell. Safe to Tell is an important tool, and Essie Ellis, who's now leading Safe to Tell, is here with us. Where's Essie? She's back in the back. Let's give her a round of applause. And with apologies to all the leadership here at the Anschutz Medical Campus, we did hire her away from you. She was doing great work here, emergency preparedness. She will do great work on behalf of our school kids. And the trainings that this office does is very powerful. Over 140 trainings across the state this year alone to give people the guidance that, you hear this phrase, if you see something or if you hear something, say something. And you can reach out to Safe to Tell online by calling, and we have gotten over 16,000 threats that have been tipped off that's been able to investigate it last year alone. The final piece of this, after worrying about the climate and developing a threat assessment tool, is to actually be ready to respond. This was something that was not on our radar screen 20 years ago, and now, to be a responsible school, you have to actually prepare what would you do in the face of an attack. There is a standard response protocol that's been developed. It's important that schools adopt and train teachers, administrators, and students. And 80% of those in Colorado have. These are all basic steps that we can work together to help provide guidance to schools in our state. We have reissued something developed under my predecessor, Cynthia Kaufman, a school safety guide, which provides information and best practice. And this is where the work of this center is so important, going back to Dell, who is so committed to this, evidence-based practices. We need to test what we think we know to see what really works. And that's what this school guide shows. And I want to thank Dr. Sarah Goodrum, Beverly Kingston, and Bill Woodard for your leadership, again, Dell's legacy, to develop the expertise that our schools need. And we will be working with our schools and Safe to Tell to get this information out there so that whatever the tools are, evaluating the climate, responding to threats, and being able to manage in the face of an emergency, we're prepared to do the best we can. And we're up against some challenges because there are people who want to say, do we have to do this? I don't want to scare our kids. Well, this is the world we're living in. And we don't serve our kids well by not preparing for the possibilities of these threats, for not taking seriously that bullying and harassment is real and is a threat. Having a place where tips can go, we can actually, and we do actually, save lives, whether it's suicides or attacks on others. Within 15 minutes of a recent threat, for example, police were able to investigate and determine that a student was having an adverse reaction to medications. And the result was that student got medical attention. But if that hadn't happened, that student could have had an episode and could have been endangered and maybe endangered others. We've had school shootings that have been threatened and responses have come within 18 minutes, leading to an arrest that day. These are the success stories of Safe to Tell. We need to constantly be asking, how can we do better? In Colorado, our spirit is to be collaborative problem solvers. We're not going to rest on our laurels. We are going to commit, just as my predecessor, Cynthia Kaufman, said, to ask, how do we do better? How do we work together to keep our kids safe, to make school safety a priority? This is not a topic that people often want to talk about, but my message is clear. We have to confront it. The Safe to Tell program is a crown jewel in our office. We will do our very best with this program, with our school guide, to be partners. If you want to partner with us in any way, shape, or form, please reach out to me, Essie Ellis from our Safe to Tell operation. This effort is one we can all do together. Thank you for your engagement, and I'm looking forward to working with you all. Thank you very much.
want to thank Attorneys General Coffin and Weiser for their remarks. They certainly fit well with what we've talked about across the day and the need for successful collaboration across many sectors in addressing school safety. I'm now going to turn and introduce Larry Cohen, our moderator and concluding keynote speaker, a social worker and a social activist. He's helped shape the nation's thinking on the importance of prevention and the policies and community-wide strategies to achieve it. I'm going to touch on just a few of the areas where Larry has had impact. Smoking regulations related to restaurants, workplaces, and public places, vehicle safety policy, unhealthy eating and physical activity, prevention in mental health, and more. Relevant to today, he led one of the nation's first countywide collaboratives on preventing violence, and the group cut across homicide and assault, suicide, battering, sexual assault, and child abuse. More recently, he led the Unity Network, Urban Networks to Increase Thriving Youth Through Violence Prevention, a national initiative to strengthen and support cities to effectively prevent violence. He's also worked with WHO to advance violence prevention worldwide. He founded the Prevention Institute 21 years ago and led it until last fall. Delighted, Larry, that you are here, and please come up to lead the panel discussion, and then we'll move on to your keynote presentation. Thank you.
Hi, everyone. Hi, everyone. It's been a pretty, can we have the panel come join us? It's been a pretty deep, profound, astounding day. And then again, it's been, for me, it's been a very profound day. Thinking about Columbine, first time I heard the word 20 years ago, and thinking about how far we've come, and thinking how far we haven't come. And so I'm really excited about this panel because it's really an opportunity to talk practice. And we have a real sense and have had a tremendous amount of information shared with us, which obviously has tremendous implications for practice. And now we're going to really dig in on a practice level. We're going to speak a little bit more on the soundbite side because we really want to cover a lot of information. I'll tell you who everyone is on the panel, and then we have some questions, and ideally we may even get to some questions that you have in addition, or some additional comments. We have Christine Harms. Good afternoon, Christine. And as many of you know, she's, like me, a former public school teacher, also private school administrator, psychotherapist, and a trainer with over 30 years of experience working with youth professionals and parents. She was a coordinator before coming to Colorado of a suburban Philadelphia school safety center, and has trained professionals in violence prevention, school-based crisis response, emergency preparedness, trauma, sexual misconduct, suicide intervention, and threat assessment. That's a very long list, but it's also a very, very interrelated list. And she's taught at the University of Northern Colorado. John Michael Keith, hi John. John is executive director of the I Love You Guys Foundation, best name for a foundation I've ever heard. For nearly a decade, he's represented the foundation to districts, departments, agencies, and organizations regarding school safety. And before that came from a career which spanned issues like graphic design and communications, writing, software, database development, and the death of his daughter, Emily, at the hands of a gunman at Platte Canyon High School compelled John Michael to bring his professional expertise and his breadth of expertise to the arena of school safety, for which we are all very, very grateful. Allie Maffey works as the Policy and Communication Unit Supervisor for the Violence and Injury Prevention Mental Health Promotion Branch at the Colorado Department of Public Health and Environment, where she analyzes the impact of legislative and systems change to impact injury. I'm glad to be reading legislative and systems change, because we'll be talking about that ever more as we answer the questions of the Attorney General about what are each of us going to do and what are we collectively going to do. And she's looked at the impact of legislative and systems change to impact injury, violence, and substance abuse as priority issues. She also manages the Communities That Care initiative in Colorado. Susan Payne, who I've now known for almost 24 hours, is the founder and former executive director of Safe to Tell, which, let me say, I didn't quite know its origins until today, but have known its work and the value of its work throughout the country. And I'm enormously grateful for the kind of work in creating that initiative. And that was developed, as most of you know, as a response to the Columbine tragedy, here in Colorado. She's a 28-year law enforcement veteran, has been a detective in the Colorado Springs Police Department, and the first special agent with the Colorado Department of Public Safety, Homeland Security, as she served as the director of Safe Schools at the Colorado Attorney General's office. That's where she directed Safe to Tell. She does training on a lot of things, including digital threat assessment for safer schools together. And as Deborah mentioned this morning, the importance of public health education, law enforcement, all partnering together is re-emphasized and here in person with Susan. And certainly not least is Kevin West, who's currently a district administrative specialist for Adams 12 School District in Thornton, Colorado, and is serving as administrative liaison to the department's charter schools. He previously served as the district's director of intervention services, and he was the lead developer of the widely used Adams County Threat Assessment Protocol. So that gives you a thumbnail of our panelists. I'll ask a series of questions to different people, whoever wants to pitch in. But I'll start with one that probably many people may want to answer, which is, what's some of the work you're doing you want to describe that you think would really benefit from more? And by more, do you mean more resources or more intensiveness or more breadth and scale or all of the above? And Allie, why don't we start with you?
This on, there we go. So as mentioned, we work with the Communities That Care program here within the state, which was an incredible opportunity using retail marijuana tax cash dollars to scale up an evidence-based community organizing model, CTC, in 47 communities across the state. And this has been an incredible learning opportunity. And what I hear over and over is that these communities, more communities want to be a part of this work. They want additional funding to be able to do this same type of primary prevention, organizing, using local data, which we're able to get using the CTC validated scales of risk and protection that are included in our Healthy Kids Colorado survey. 70,000 youth across the state finish that survey every other year. And it's done by great people here at the university, would like to point that out. And we're able to use that data locally to empower communities to solve their own problems, looking at what do we know puts youth at risk universally? What do we know are protective factors universally for a variety of substance abuse and violence outcomes? And we can only fund 47 communities in the state to do that work with the funding that we have. And we hear repeatedly that they want more investment in the ability for more communities to come on board into that model, but we also hear even that money that we do, that's just for the community organizing of this work. That isn't for all of the evidence-based strategies that they select to implement. And again, we have some amazing opportunities through programs like Tony Gramsci's Youth Services, which fund evidence-based programs, but it still is insufficient, the amount of funding that is needed. And I think people often worry about throwing so much money, are we duplicating efforts? And I don't think we ever put enough money at prevention to ever duplicate each other. But there's not enough happening in these communities. And they are noticing needs, they are trying to solve their problems locally, they are using local data. These are empowered community members doing great work. And we don't always have enough funding to throw up at that ounce of prevention to prevent the pound of cure that would be needed otherwise. And so it's really difficult to direct those types of resources, but it's really amazing and powerful to be part of an effort where you watch communities empower each other to become part of solving their problems locally using that way upstream perspective.
Thank you. Susan, what about you?
What I would say is, really young people know long before adults what's going on, especially in the digital world that they live in. And I think that's why Safe to Tell has been so successful in providing a protected method of reporting and knowing that young people fear retaliation, that if they have information to give to even help a friend or a sibling or a peer that he might be suicidal or self-injuring or making threats, they're reluctant to do so, and it's no less courageous for them to speak up in a way that gives them a safe, protected method. But going further than that is when we share that information, most of what people don't understand is another measurable outcome is that it's connecting the multidiscipline team at every school has to be identified. That team has to also be professionally developed to understand what works in the intervention strategies and how to conduct effective risk assessments, threat assessments, and digital assessments in this world. Additionally, those reports are going out to not only the school team, but also to the law enforcement dispatchers, because most of the time these reports are after school hours, in the middle of the night, on the weekend. That's when young people are vulnerable. And when that information comes in, what we need from that school team is, where is this student living? Who are their parents? How do we get a hold of them? So that's part of what's been so successful, I think, with the Safe to Tell program.
So to what extent would you say the threats are about things that are going to happen in school versus things that might happen in the community or might happen in the home or might just happen anywhere?
Well, I'd have to look at the numbers for that, and that might be a call for Essie or someone else doing the data analysis. But I think what is really surprising is how many are out in the community, and it's young people that are self-injuring, they're at a party, they're drinking alcohol. We have to look at the issues facing young people today. What are unhealthy behaviors? And the thing that I would add is working with Parkland currently is in the aftermath of their tragedy, we know from a perspective of research that there will be secondary death. And we see these completed suicides of survivors, and yet it starts with prevention and it ends with prevention. We need to invest in prevention in the aftermath of a traumatic incident to really help the survivors grieve in healthy ways and to reduce the likelihood of suicide.
You know, my work, we looked at ACEs, adverse childhood experiences, and we said we need another term here as well for ACEs, which is adverse community experiences, because the community impacts can be as traumatic. So is part of the expansion, you might think, somehow broadening your outreach community-wide as well as school-wide?
Well, I think that what we've seen is success in different states that have effectively built the same framework. They might call it something different. We still need to continue to study what's effective, how we deal with reports that might be a misuse of the system, how do we integrate increasing layers of protection, but it's part of a comprehensive framework, and we all have to do it in collaboration and partnership, and it's really bridging what we know from research into practice. And that's one of the things we were able to do, identify a team, look at culture and climate, because young people are going to be far more likely to speak up and recognize the warning signs if we've had the conversation with them. They have to be part of the solution, and culture and climate is critical to that, to their success.
That's really helpful, and I'd like to come back in a little while after we hear from others to this culture and climate question and how to be more inclusive. This might be a good time to bring you in, John Michael, and talk a little bit about your work.
The I Love You Guys Foundation offers programs at no cost to schools, districts, departments, and agencies. And we, how's that? We introduced the programs tentatively. We started in 2009, and they became adopted fairly rapidly. And it really brought home, I think, what the real magic of this was. And that is that it's a Trojan horse. We created a program that was digestible and achievable. And I think we can take advantage of that learning experience as we start moving upstream in all of this. Are there other areas where we can create that digestible piece of a program and then reinvigorate and motivate our audience to adopt it? And that's really, I think, what the foundation has done. And as we see that progress, that's where we're going to be taking our experience with other programs.
So when you say a Trojan horse, what are the pieces that you want to bring as the extra surprises or the extra elements that you think, from what you're seeing so far, really should be advanced?
What we've seen is that the schools will take the standard response protocol, achieve success, and then they start looking upstream themselves. Let's take a look at threat assessment and what does that look like? And if we can have that conversation, let's move further upstream. Are there climate and culture programs that can impact the outcomes? And in order to get to that point, can we motivate that organization to do the climate survey? Because without the data, none of it's doable. And it's moving upstream and moving the motivation upstream that I think is really our next step.
And you're reaching out throughout the state?
Yes, we've got about 80% of the schools in the state of Colorado are using our programs. And across the country, our estimate today is about 25,000 schools, districts, and agencies.
Yeah, I saw that in my research for this panel. I was very amazed and very impressed. And it sounds like more resources, even more, would be really, really a nice thing to do, wouldn't it be?
Absolutely.
Yeah. Chris, do you want to, you've got the mic now.
Sure. Those of you who know me well can probably guess what I'm going to talk about, and that is the issue of suicide. We've talked a lot today about school shooting, and as Dr. Osher said, it's not an issue that we have to be as concerned about because our schools have done an excellent job of working on that. However, we have had what I would call an epidemic of youth suicides in our state, and if you look at the data from this the Department of Health, in 2016, we had 77 suicides of our students ages 10 to 19, and in 2017, we had 98, which is a 27% increase. And as Susan was alluding to, oftentimes this is in reaction to some of the other tragic events that have happened at schools. And suicide is not a school issue. It, like everything we talked about today, is a community issue. And my heart breaks for the schools that are getting blamed for the suicides when it's the community that has to rally around everyone to address this issue. And when you asked, what do we need? We do need more resources here in Colorado. We have done so much in school safety and so much on a shoestring in many cases. And as a state employee, I'll go out on a limb here and say we need more state funding for this. Last year, it was wonderful as the this governor this morning, the lieutenant governor, excuse me, as she mentioned, we did give $60 million we got from the legislature for grants for schools, and that was mainly for interoperability, something we desperately needed, as well as security measures in many of our buildings, but only $400,000 came down for suicide work last year. And we desperately need more mental health providers in our schools so that we can make sure that our kids who have mental health issues are getting the help that they need. And I'll pass it on to Kevin.
Great.
So unlike Chris, those of you that know me have no idea what I might say when I'm given a mic. So I actually had some remarks prepared, but our last poet took those. And so he ran with it and did much better than I could have. So.
Say them again.
Yeah, I won't say it again. So a couple of things I haven't heard today. I have my title right now is Administrative Specialist, and that's not by accident. That's because after the last 22 years of doing this work, even before Columbine, I became interested in this work as a school administrator because someone in a school that I worked in threatened my family and I through something called an underground newspaper. I don't tell that story very often, but that was back when you wrote things down and passed it out versus sent it around. And it was very real to me, very traumatic for my family. My wife was terrified, and my district had no concept. They wanted to support me, but no concept of how to support me or our family or what to do. And kicking the kid out to have more time during the day to figure out ways to harm myself or the principal or others wasn't helpful. And so I became interested in this topic then, and have spent most of the last 22 years working in schools, on schools across the state and other levels, trying to help schools make sense of something that has no sense to make. And I would say a couple of things that I haven't yet heard today. What I need more of, or what I've always needed more of, is time, and no one's given that to me yet. What they have done is given us, as school administrators, and those of you in the building that work at school or those of you in the room that work at school buildings, bless you for your work, because the list of things that you're expected to be on top of and responsible for has grown exponentially, and not only since Columbine, but in the years leading up to Columbine, and maybe even more money. I will say there's more resources now than there was previously. What I didn't ever have was more time to manage that. I definitely felt more obligation to manage it, though. And so I think as we look forward, we look for ways to, as John Michael said, he didn't describe it this way, but I think of them as simple steps and winnable battles. And it is really to go through and put an entire climate culture, school environment plan in place and study it and do evidence-based programming is a long and arduous but very important process that we should do. But in the interim, if you want to put every kid in the building's name on the wall and say, does somebody know this kid personally by name, strength, and need? That's a good starting place. And I think we have to identify starting places, because what I've seen is, especially our rural partners in small schools across the country, what they tend to do is just shut down and say, we can't do any of that, we can't afford any of that, we don't have the time to do it, and that you don't get to opt out of this program. And then the last thing I would offer is that I get a chance periodically to talk to teacher preparation programs or administrator preparation programs, and I would say this is still not a focus often in those programs, and I know that because the questions they ask me reflect sometimes fear, respect, but just a general lack of understanding of what am I about to go into. The sad truth is we've got our first crop of kids that now are in those positions that have been through this and grown up in this system, but I would say we ought to look at those programs and the opportunity to prepare future candidates. And I would say the same thing for parents. There's no teacher prep or there's no parent prep academy, but parents have these same wonderings. So figuring out ways to educate parents and to be parents.
So in a way you're saying, I think what you're saying is maybe that's a piece of what happens in the schools, is that the schools have more communication with parents? Or are you speaking more broadly?
I don't think of it necessarily as a school function, and I've found it brain damaging through the years to try to figure out what I should and shouldn't be doing as a school administrator, or what's our role. But as a community member and a parent and somebody that advocates for kids, I'm willing to sit down, and those of you that know me or have worked with me, I will sit down with any problem solver that wants to figure out how to do that. And I've also encountered problem finders that have no interest in doing that, or problem admirers that admire problems, but I really want problem solvers. And so what I would say, my real answer is community to community, it may be a little bit different, but ask the question and find the partners to do it anyway.
Great. I really want to talk about community. I want to ask actually a handful of other questions, and I'll say what they are. And one is about what else we should do in schools. And then the next is, well, okay, that's schools, but what should we be doing in the communities? It was interesting, Chris, that you said, well, a lot of the problem is in the community, and yet the schools are being blamed. And then at least the piece of the solution you named as a concrete locus was more mental health support in the schools, which totally makes sense. But I'm wondering also, what do we need to do more of perhaps in the community? I want to ask about that. And then broader strategies, really from the audacious perspective that when I look at the charts that people presented today, though there's lots of positive outcomes, there's lots of learnings, you know, there's a lot of problem out there. There's a lot where we haven't shown, partly because we're going against the curve that was headed upwards. We haven't shown the outcome we need. So I want audacious thinking from all of us. How are we going to do much, much more? How are we going to really not just say, well, gee, let's be practical, but say, hey, we got to be insistent about this because the stakes are so high. So talk about strategy, talk about policy. Ali, let me ask you first, though, about the schools, because you talked about your program in the schools and you've heard about others. Are there other things you think would be important school-wide? And after I ask Ali on all these questions, now I just want people to jump in as you feel the sense of need or the sense of what you think is important, even if it's not quite answering the question I asked. I don't care.
What I loved about so many of the speakers today is looking at what it takes to build the meaningful relationships with youth, to create community, to create an environment where people trust each other and can connect. And there are things that we can do legislatively to give people the time and the space to make the connections and build the meaningful relationships with people in their lives. And so for me, the first thing that comes to mind whenever we talk about schools is we are 48th in the nation for funding through K through 12 education. We don't even equip our teachers to do what their jobs are, let alone the million other jobs we throw at schools and the other responsibilities that we throw at schools. We don't even have sufficient basic funding for schools. My husband was a middle school teacher. He now makes like twice as much money just doing carpentry, which, by the way, he's like, so why do we encourage kids to go to college? Because now he's paying student loans for a degree he doesn't use. But for him, he had 180 students every semester. He did not have relationships with those kids. And when he tried, he was chastised for not following the criteria of what the school was trying to achieve because he wasn't giving enough homework. So that's why he's no longer a teacher. So when you look at what's happening in our state with our funding for what a teacher's job is, and we know that their academic performance improves based on the meaningful relationships and connections that kids who feel safe at school, all the research that was shared earlier, we know that that happens. And yet with classroom sizes and with how underfunded our schools are, with the recruitment issues that communities have, and especially in rural areas to be able to get high quality teachers, with the poor salaries that we have, teachers have effectively not gotten a raise in, 3 decades? It's abysmal for us to then say, what else should schools be doing when we aren't even funding them to do what their current basic job is, let alone adding on the mental health care and concern and all of the things related to violence. So I can't not say anything about that issue. And then I think the other issue is really that community care piece, which is why I really do love the communities that care model and watching communities come together to say this isn't something we can point a finger or place a blame, and this has to be all of us coming to the table. It has to be parents coming to the table too, and lay people, because we as professionals in public health, though we know the research, don't have the answers. As you said, we have to listen to the youth themselves who know a lot more about what's happening in the community. So really elevating youth voice in that community organizing effort to make sure that they are actually part of solving the problems locally. But I read a quote recently that said, when we scream self-care at people without recognizing the need for community care, that's when we fail them. And so for me, it really is approaching this from a basic funding for each of the areas that our expertise is in, and then coming together to leverage those resources to make the best use of all of them, including youth voice at the table, including parent voice at the table. And I would love your parent academy when you start it.
Chris, since you've got the microphone.
I'd be happy to.
It seems like on issues like this, if we are in agreement, and on some of the broader issues we've been talking about, partnerships really help. And maybe we need to think about partners beyond the usual suspects, and maybe we have to a certain extent. Are there new partners we should be engaging, or some partners who are maybe just engaged on a peripheral level who we really need to get them to participate better? And are there strategies we have for getting new partners?
It's probably both. And I'm thinking, for instance, we've mentioned parents a number of times, and we know parents are extremely stressed these days. And I'm a little tired of hearing schools say, well, we have an assembly and the parents don't come. Parents are so overwhelmed that we have to find other ways to reach parents. I know, for instance, Denver Public Schools has a radio station, and they also broadcast in Spanish so that they reach their parents that way. And
That's
I
great.
think those are the kinds of strategies we have to come up with. I've heard stories where a school will take one particular issue, maybe it's marijuana, for instance, and they will make a one-page information sheet on that, and they will train their teachers so that when the parents come to parent-teacher conferences, they will take 5 or 10 minutes and just go over an issue that they want to educate parents on. And that makes so much sense, particularly since our parents these days have no idea about the potency of the marijuana that our kids are exposed to. So I think we have to think outside of the box when it comes to that, but I know that some school districts are engaging their faith communities as partners in some of these issues, and I think we have to ask even our business people to help with our schools. And I know we've had a project in the past where we've tried to get businesses online, particularly to help our schools, because as Ali said, they are so underfunded when it comes to any kind of resources.
And a lot of businesses have said, we're invited sometimes, but when it tends to be we're only invited to give money and not for strategy and not for participation. So I think there may be an opportunity there. And frankly, I think when people start participating, the money increases as well, and the other kinds of resources increase.
I was just going to jump in there, and I really do think that what we have to deliberately do is break down the silos. We are so much stronger when we are working collaboratively and in partnership. It's not community that cares, it's not the School Safety Resource Center, it's not the public health, it's all of us together. And breaking down some of those barriers are really important, cross-training and understanding each other's work. But I also think it's so important to involve child fatality review teams, because they are working diligently to uncover the evidence and the results of when there has been a child death. And that's where it's so alarming when you hear how preventable it was and how do we do a better job. So whether it's violence or youth suicide, we are seeing definitely a cry for help or something broadcast in advance. Do we know the warning signs? Do we know the subtleties of the behaviors we're looking for in schools, in community centers, at rec centers? When kids are crying for help, it's not always that they're broadcasting it with a megaphone. Sometimes there's subtle signs that adults need to be looking for in the community, and we can be stronger together to intervene early and avoid that pathway to violence, or provide the system of support so necessary for children that are struggling.
Yeah. And I'm wondering, because we talk about children that are struggling and children that are crying for help and getting to them sooner and early warning. And I'm wondering, how do we reduce the number of children that are so desperate? What are some of the strategies in the school or the community? What are some of maybe the climate approaches that you've seen or that you yearn to see from the work you're doing? That would, I feel like there's, a retail and a wholesale. What is the big picture work we could do at the same time that we're working and getting to the students in need more quickly?
One thought that comes to mind for me is we've talked a lot about upstream, and that's certainly something that has resonated with me for a long time. But I don't know if we recognize how far upstream we really need to be, and the assumption that somehow pre-K kids or kinders or first grade kids come to school with these skills. They come with what they've observed, and increasingly if they walk by the TV, what they have observed, or if they walked by the computer, or if they've observed two hardworking or one hardworking parent that's not able to be at home as much as they'd like to. Increasingly, that influence may not be there as much as we'd like. And so I think it's incumbent upon us as a system. And when I say us, I'm not talking about schools. I'm saying us as a community to figure out how to provide access to the skills that we want to see from kids. Through the years I've been involved in, I'm not proud to say this, but this is the reality of the job I've had. I've been involved in over 2,200 student expulsion cases. All the way back to the zero tolerance days post-Columbine in the state of Colorado. That's not a record you want to be part of. And what I would say is one of the first questions that I always ask when I would get an expulsion referral, or I'm asked, or even right now as I'm acting as an expulsion hearing officer, is how do we know when and what this young man or young lady was taught? Like, not what did we expect them to do, but what did we teach them to do, and where did we teach them to do it? And often We might have handed them a code of conduct, or we might have given them a lecture on the first day of class, but I don't know where we taught them. Did we do it through Incredible Years or the Good Behavior Game or any of the other evidence-based programs that we could have been doing really early, maybe that would have prevented them from ever being in that room with the guy they didn't want to be there with? And so I encourage us not only to think that way, but to invest in that. When we talk about upstream, it's really hard for high school teachers to say, I'd love to see the wee bit of money we have go to pre-K and kinder, but if that's what we need to do to slow down the flow, then I say we look at those resources and invest in prevention in that regard. And then one other, you ask about audacious ideas. One audacious idea that I would toss out really quickly is there was a report in the late 90s, it's been redone since then, called Prisoners of Time. We've been prisoners of time in education for years, and there's nowhere in law that it says that teachers are only available for 183 days a year to learn. And so maybe we look at time different. I worked in a district once in another state prior to moving to Colorado where we had 13 extra days a year, and we actually had time. It was for teacher development and growth and staff, but we actually had time. It didn't feel like you were rushing it in on a half day on a Wednesday right before spring break to get together and talk about some of the most important things that we needed to talk about for our kids. And so I would say that's the one thing we may not have done. We do talk about money, I agree with that, but more money doesn't give you more time right now. And so time, thinking about preparation to be a teacher this year, not the preparation you got when you went to a teacher prep program, but what do we need to do, and mid-year. Because honestly, when I'm doing presentations to schools or working with staffs, they kind of give you that glassy-eyed look saying, I believe in the data, I believe in the message, I don't believe I know how I'm going to manage that. And
so just additionally to that, we were going to talk a little bit when we talk about upstream, but when we talk about youth suicide or where young people are, one of those programs that we know when you saw those dollar for dollar investment was life skills. So if we can agree that young people in the social norms today are going to face failure, disappointment, and loss, and how resilient are they? How many skills do they have to cope in those things in a healthy way? So it's important that we look at getting more upstream of this and how do we integrate that into our education system to make sure that our young people are coming out with those life skills.
I so agree with a social emotional learning program. We had 3 summits back right before the holidays where we actually asked youth what they needed. And it was really mind-blowing to me to find out how stressed they are. And most of them, school stress was further down on the list. Their stress was from home. The way families are just at wit's end in some cases, and kids who were raising other kids in the household had to make dinner, had to work a job in order to help the family make ends meet. And so what they said to us is we need schools to teach us stress reduction methods. And I know a lot of our schools are doing mindfulness and other stress reducing methods now, and that's the kind of thing we need to do to help our kids deal with all the stresses that they have.
Great. Could you pass the microphone?
I just keep thinking of that image, Beverly, I believe you had on one of your slides, of all of the ladders and someone still standing on them and not able to see over the wall. And that's, so I totally agree of the time issue. Like these, we can't expect anyone to add yet another evidence-based program on top of an evidence-based program, on top of more professional development, on top of here's what you need to know, marijuana is newly legalized in the state, here's what you need to know about that now. We have an issue of suicide, here's what you need to know about that now, without addressing these primordial prevention, as the dean said earlier this morning, these primordial prevention issues that are at the root of all of this, and a lot of that being how are we reducing the stress, pulling the weight off of people's shoulders, whether it's teachers or parents or the youth themselves, and giving them the time to explore the skill development that they need.
It feels like, from what I'm seeing nationally, that there really is going to be a movement. I don't know how big, but, or no, I don't know to what extent it will move, but there's clearly going to be movement for greater teacher salaries. And I'm just thinking, you know, there's a marker here of pairing that with a partnership of saying more money because we need it so that we have better teachers and so we have less carpenters, and also more time because we need people to not feel so pressured that they can't afford the additional time. So that, I mean, that's one very concrete policy idea I'm hearing. Here, we just have a little bit more than 5 minutes left. I had wanted to ask 2 other questions. One was more on policy. The others were talking more about youth as the recipients. And I'm wondering, and Art to Ashes was such a, no, Art from Ashes is such a was such a vital program and such a vital experience for me today, about youth role. And I'm also want to just give people an opportunity, if there's any last comment you want to make before we close, to to add to that. The youth question actually came from the panel as well, from someone who typed it in. So let me just turn it over to any and all of you. And John Michael, I was going to ask you to talk about the policy issue, but just go wherever you want to go.
Policy sometimes terrifies me. I actually am going to go to the youth issue. And again, we work in the area of response. And we've had conversations today talk about drills and trauma associated with that. And we really promote a no trauma, no drama drill philosophy. And I really think it's important that we do have the conversation. I had an opportunity in Sarpy County, Nebraska, to participate in an exercise. It was a full-blown exercise. It was an active killer event. There were 900 participants at this exercise. So it was the county sheriff's office, law enforcement, fire, EMS, and they had 200 student volunteers. And just before the exercise got started, I'm going down a hallway, and there are these two teenage girls standing there. They're very excited. Their role in the exercise is to scream. And we're talking, and I pointed to one of our posters on the wall of the hallway and asked what you think of that. And this young lady looked at me and she said, there are things the grown-ups don't want to talk about, but when that poster went up, they had to. And I asked her, why is this important? And she said, you know what, sometimes bad things happen. If something bad happens at my school, I need to know what to do. And then she looked at me and said, I need to know that the grown-ups know what to do. And that's the part of the conversation. Our kids are demanding this conversation. Let's, as adults, figure out on how to have this conversation without the drama or the trauma. We can have this conversation. I do a lot of flying. Often the flight attendants will demonstrate the oxygen masks. I have yet to be on a plane where they actually depressurize the plane in order to demonstrate oxygen masks.
Excellent.
We can do training without drama, trauma, etc. And same with water landings, okay? They talk about them. And make me buckle up. That's terrifying.
Let's not discuss this before I fly home tonight. We have a couple of minutes left. Any other final comments or thoughts people want to share?
I would just add one other voice that I haven't heard mentioned today that I think we overlook until we need to look, and that's the faith-based community. And I encourage you, in whatever your community is, I guarantee you, if you've got a post office, you've got a church. And I encourage you, regardless of your beliefs, is secondary. I believe that folks in churches all across the country love kids, and I believe we're here because we love kids, and that's good enough for me. So we can meet right there. And so I think otherwise leaving them out of that conversation does a disservice to kids, because when they leave schools, which inevitably they're going to do, I've seen us push them out. When they leave, they need other places to be doing positive things, and that's one of the places that I've found to be valuable partners.
That's great. I found that in coalitions, faith leaders were extremely helpful. I remember one when there was a big conflict saying, well, I have a higher vision, and kind of could bring everybody back to the real purpose and away from the disagreement. Any other? Please help me in recognizing an extraordinary panel. And not just as panelists, but more so for the incredible committed work the five of you do. Thank you so much.
Would you like to introduce yourself, since you're...
Oh, are you?
No, I'm joking. You need no introduction at this point. You've been introduced.
Yeah.
Welcome.
We've heard a lot of people speak today. I'm going to try and solidify some of the ways that we translate research into practice with the notion, and we had a lot of back and forth, and I sought a lot of advice to come up with the title, and it's only going to be on the screen for a second, but that prevention is really a community imperative, and the emphasis might be on prevention or it might be on community, and it's also an imperative You know, this is not an issue where we can just do a little bit more. And, you know, I use the word audacious deliberately with the panel. I chose this picture for a number of reasons. One, because it represents art and creativity and aligns in a different way with the word art of Art from Ashes. Also because for me it's local and it's inspirational, and it's about the healing that sometimes has to come from talking about what's not okay, from fear, from disappointment, from depression. And this obviously is Oakland, but the plea to stop youth violence. It's been said a number of times today, we know what to do. We know what to do. We have a lot of the research. There's plenty more to learn. We can cut violence rates. We can cut deaths. We can cut assaults. We could cut homicides. We can cut suicides. We can cut sexual violence. The biggest issue is political will. And someone asked a question before. I saw it scroll on the screen, though I don't think there was an answer. You know, how do we get both sides of the aisle, referring, I assume, to Congress, either on a state or national level, how do we get both sides of the aisle satisfied? And I think the answer is we give voice to an imperative that both sides of the aisle must hear. We've seen that happen to a certain extent with health reform. We've seen that happen in bits and pieces of that. And we need to make clear this is an issue that everyone cares about, and it doesn't matter about which side of the aisle. And we can't let lobbyists and we can't let legislators to decide it without a community voice. If our airports are safe, our schools must be safe. If our airports are safe, our communities must be safe. We know this, we understand this, we know what to do, we must demand it. This, Deborah shared this also, this notion of the prevention continuum. It actually comes from work we were doing with cities around the country, from young people in Philadelphia hearing the public health terms of primary, secondary, tertiary prevention, and they put it in real terms. And that's the value of youth. That's the value of youth voice. That's the value at times of inappropriate language. The youth voice we see, we hear. We need youth voice. They have a right to be safe, but as someone just said, we are the adults in the room. We are the ones with the responsibility, and we have to take that responsibility and understand they have the right to the outcry, the leadership from Parkland students. We can't have leadership just from students. The leadership must come from us. So I want to talk about 4 very quick tenets of how to translate to practice, build upon prevention's history of success in other topics, and several people have mentioned this already, emphasize the community environment, which of course includes the school environment as one critical set of communities, the importance of collaboration and cross-sectoral efforts, bringing different sectors together, and then perhaps most importantly, we have to not just have voice, but raise our voice on multiple levels, in multiple ways. So building upon prevention's history of success, starting with tobacco, this is what it used to look like, and healthcare was there on the wrong side of the issue. I was involved with the nation's first multi-city no smoking laws. It's hard for many people even to remember that there would be ashtrays at every one of these seats. That was normal. And by changing the norm, using policy as a tool, but also practices as a tool, we saw a 50% drop in California, and we've seen drops not only across the country, but across the world. So policy is a tool, norms change is a tool, and we talked about the smoker, getting help to the smoker. We talked about the manufacturer. We talked about the product. We must do all of that. Car crashes. Someone mentioned car crashes. Again, a major killer, a major injurer. We talked first, I think, about DUI with community leadership, Mothers Against Driving Drunk playing a critical role in that. We talked about car seats and seat belts and airbags. And just like tobacco on the top, we saw when we talked about these issues and focused on policy change and practice change, we saw tremendous reductions and continue to see reductions from that work. Though right now the work of cigarette companies to find a new solution through e-cigarettes like Juul is horrendous and unethical, and we need to not stop. But at least we know what to do, and we need to continue, moreover, to do it. And then, of course, there's pedestrian and bicycle safety. Looks like we've got a ways to go. Frankly, I added this slide because I thought we needed a chance to laugh and needed a little bit of a break at this point of the day. Someone sent it to me. Florida was mentioned before. Needless to say, this is Florida. No epidemic has ever been resolved by paying attention solely to the treatment of the already affected individual. We know that work is critical. We know we need to get to people sooner, but as those past examples I just shared show, we need to work at the same time on the environmental, the product, the community-wide strategies, the policies at the same time that we work one individual at a time. And so if we're going to emphasize the community environment, is this a suitable environment? This picture comes from Brooklyn, where I grew up. Somebody thought it was a clever way to go into the playground. Everywhere. If guns are toys, if guns are fun, if guns are for shooting, you know, what are we telling young people? What are we telling one another? And so there's been this toggling back. Is it gun violence? Is it mental health? You know, each trying to say no, it's the other. And clearly, I think we all understand it's both. They're interrelated. We need to work on both levels. Violence is complex. That means the solutions must be comprehensive. We can't just pick one thing and do it. Another example. This was somehow America's Top Model thought it was sexy and fun to do an edition on women being treated violently. This is a billboard I took a photo of near my office. Compare that to a photo I took in Philadelphia. And you see how we can transform the environment positively or negatively. We're the adults in the room. It's up to us. Stigma in schools, in communities. We've talked about that a lot already. Gender discrimination, all the issues now of weight. I love this label, jars, not people. And I want to emphasize that while we're all affected, disenfranchised communities are affected more so. And the same issues that increasingly strike all of us hit much harder in certain communities where the environment is less supportive and harsher. It's unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such changes. This is, to me, one of the most important quotes to ever come from the Institute of Medicine. It wasn't just talking about violence. It was talking about a variety of issues. It's unreasonable to expect people to change their behavior easily when the forces conspire. So we need to change the social, cultural, physical environment to improve the behaviors we're concerned about. Collaboration, cross-sectoral efforts. We were just discussing this on the panel. I love the metaphor of a jigsaw puzzle because each of the pieces may be useful, but you put them all together. This jigsaw puzzle is a puzzle of a partnership that I was involved with in Denver, where a city council member said, we've got a park with areas that are not safe. We need kids who need jobs. We need healthier food. So they created not a community garden, but a community farm, brought together agriculture, public health, violence prevention leaders, schools, city council, faith-based organizations. It was a good solution, and like much collaboration, it solved multiple problems. It fit all the pieces together. Deborah mentioned Unity. Unity was funded by the Centers for Disease Control, and she and I were the co-chairs. We worked with about 25 or 30 cities across the United States. The first thing we did was commissioned a study. Billy Weiss at UCLA conducted the study where they talked with mayors and school superintendents and public health commissioners and police chief, and the astounding conclusion was the cities with the greatest success in violence prevention were not the ones with a certain program. They were not the ones with one charismatic leader in public health or education. They were the cities with the greatest coordination across sectors. We tried this in a number of different cities. I went into San Francisco, for example, when Gavin Newsom, who's now the governor of California, was the mayor of the city, and we brought together all the different county agencies, and we said, what if you all work together? And someone from economic development came up to me as soon as the mayor left the room and said to me, Larry, I'm from economic development, and I'm really kind of in a rush. And you understand, economic development has nothing to do with violence prevention. It doesn't really make sense for me to be here. I think we all understand. So Minneapolis was probably our best example because the mayor, I sat there one time, the mayor brought together his entire cabinet, and apparently he did this once a month, and they each went around and said what they had done in the last month to have an impact on violence prevention in their city. You know, and the parks person talked about opening the parks at night with free concerts, and the person who dealt with the transit on the Mississippi River talked about youth jobs and so forth. And they dropped their homicides by 64% as a result of partnership, concrete programs, concrete strategies, including some of the strategies from here in Colorado, which are so potent, so valuable, and need to be part of a comprehensive strategy. So that means raise our voice. That means we know what to do. That means we need to insist. There's an interesting postscript to something Beverly presented earlier, because I gave a talk at the center probably about 6 years ago, and I said, we know what to do about violence prevention. I believe I could reduce violence in any city or any place by 50%. And Dale Elliott said, that's great. We need to include that in our production. But I'm a researcher. I think I'll call it 30%. I don't want to be quite as audacious. The important point is we know what to do. The important point is now's the time for policy transformation. The spectrum prevention is a tool which says we need to work on every level, and we need to work on different levels to be mutually supportive and synergistic. So the kinds of programs we just heard about are clearly in probably 3 or 4 of these elements and stretch out into other elements. Often when we think about policy, we think about money, and money is an important element of policy. It's not the only element of policy. There's lots of decisions that can be made. But on an individual level, and it's been stated here in different kinds of ways, but I love this California campaign, though I'm usually cynical about this stuff. It was called Friends Can Be Good Medicine. And it really encouraged young people, and they had posters on the wall, and they had the posters in, I think, 9 different languages and in different places besides schools, but encouraged people to say, what can we do to support one another? And it's so much like some of the campaigns, and I love the comment we just heard about the poster, not only was for young people, but it made the adults realize they needed to deal with this. But also communities can be good medicine. And how do we transform our communities? Both the physical examples I gave you, but also the emotional support. How do we get a sense of being there for everyone, particularly the people it's hardest to be for? This is an example that I like to show. This is the Metro in Washington, D.C. As you all know, the Metro is not a safe place, or D.C. is not a safe place. The Metro was designed specifically for safety. They said lots of inner cities have problems with violence, and the Metro is one of the places where there often is fear, which then leads to less people using public transportation, which then leads to more fear and more incidents. They said, how do we design this so that it's safer? And they have about 45% less violence and less assault and less crime by doing some very simple things. Like you can see, it's kind of a straight view. There's not a lot of dark corridors. It's well lit. The entrances and exits are 1 flight above. So if anything happens on the train tracks, it's pretty difficult for someone to escape. And there are other things that they figured out, a couple of which I don't like no restrooms. But the point is, we can design our communities, we can design our institutions, we can design our spaces deliberately for safety. We can and we should. I'll quote Beverly Kingston, I couldn't get her tree. If we want schools to implement upstream prevention, we must provide support and resources. I didn't need to say this because she said it, but I needed to say it because I thought it was so important. One of the most important statements of the day. And there's an opportunity to converge. We often think about partnerships of local groups and don't think about partnerships across sectors and institutions. And you can draw this diagram with lots of other groups in the center. I had a meeting with Carol at Public Health where we put public health in the center. You could put education in the center. If you're from behavioral health, you should put behavioral health in the center. But it really doesn't matter. The point is, we really need to work together. And we need to understand that our motivations in working together might be slightly different for different sectors. Our data is different, our information is different, our tools are different, our knowledge base, the things we need training on. In fact, I created a tool called Collaboration Multiplier so you could think all those issues through and then find ways for mutually synergistic solutions that focus on preventing violence. Balanced approaches emphasizing prevention. Comprehensive strategies, neighborhood focus, the links among forms of violence, the importance of trauma. That word hasn't been used that much today, but clearly we've been talking very much about it. We have to talk about guns. We can't not talk about guns because it's politically difficult. That would be nice if people's lives weren't at stake. We need, as communities, to define what's sensible, realistic, and safe. And we need to insist on more safety, less fear, more of a sense that we have in our airports that we can walk around without worrying. I don't feel okay walking around the airport safely and saying, gee, I'm glad I'm not in a school. And guns is an important piece of that. We also need to redeploy resources to focus on prevention. And I think as I look at this, redeploy in some cases is the wrong word, because I'm not talking about pulling it from any of what we've heard about today. But I do know that healthcare could be redesigned, and someone presented this earlier today, to save a ton of money by focusing on prevention first. Moving money from after the fact, when we fail to act, when then it's in prisons, to prevention first. That's what I mean to redeploy resources. And we need to incorporate youth voice and community wisdom. So it's shifting the paradigm from investment in prisons to investment in schools and communities. From attention only to the individual, while the individual certainly requires attention, to also community-level solutions. From trauma to resilience. From only after the fact to upfront as well. Very simple. Getting there is not going to be simple, but I hope we can do it. I wanted to show this as one example that I really love, because it was a billboard that dealt with inequities that was put together by a large philanthropy. But what's really special about it is not just the message of inequity, but on the right side where they said, are you concerned about this? Here are 4 policy steps you can take, which will make a difference. We need to get to policy. We need to be concrete. Policy needs to be about resources, but it also needs to be about strategies and where and how we invest and what's okay to do and what's not okay to do. And one time, and I don't know whether it's because I showed the PowerPoint or not, but one time somebody went in there and took that prison door and repainted the door. Albert Einstein said intellectuals solve problems, geniuses prevent them. There's a certain amount of genius to it, but a lot of it is not genius. But what I think I like his hair. But what I would say is it's more about building a movement. You know, the elements are here in Colorado. The smart strategies that have been proven effective. The Colorado research, which has really helped to shape the entire country's thinking. It's a tough state politically in certain ways. You know, outside the state it's called purple, but there's a real understanding that there's red and there's blue and only certain places that are really purple. But so let's do it here. Let's build the movement here. Let's change the country as well as the state here. Let's make our children, our families, our communities, ourselves safer. Thank you all very much. I hope it was helpful.
So we are rapidly approaching the end of our time together today. I do want to say that this is not the end of this conversation. I want to acknowledge, first of all, that there were a number of really perceptive, provocative, profound comments and questions that, you know, flowed across the screen and that we just didn't get a chance to speak to, in part because we intended today to specifically focus on issues of prevention and primary prevention, and there are important ways in which response, recovery, long-term recovery, these are issues we're going to have to take up in subsequent days of conversation together, I hope. I do want to invite the organizers on stage just to receive the gratitude of the group and to close the conference. And I'm going to put up a couple of slides for you all because we would like to collect some data, because, you know, that's who we are. So we have, we've got 2 questions after Preach It, Ali. One is, what next steps would you like to see from our collective enterprise in the effort to prevent school violence? And I'll leave this up for just a couple minutes. So everyone, unfortunately, you've probably learned this by now. You only get to submit one answer to these questions. If you don't like your answer, there's a trick, which is you can type the word clear and it will remove your answer, and then you can put a new one in. Thank you, getting the youth involved. I saw that in some of the earlier comments as well, and it made me regret not having youth on that panel. Legislators doing something about it. Yeah, I'd say I saw a question about funding, and you know, not having lived in Colorado for that long, I do wonder what the barriers are to funding here. I keep hearing about the Tabor thing, and I'm not sure how important that is in this particular domain versus just generally restricting state funding, but I wanted to hear more about that as well. Arts organizations, narrative. I think the thing that Art from Ashes brought today that was so valuable was the narrative experience of these communities. I have one more question, which I'm going to put up, and this one is a little bit more provocative, because what we wanted to end on is, what have you walked away with today? And so the question we want to ask, and I know people are still typing this one in, but I'm going to move to the next one just in the interest of time. What we'd like to ask next is, after today, what do you plan to take personally away from today to help prevent school violence? What can you do? Of all the ideas that we've heard today, what can you do tomorrow? I'm going to have Beverly come up for some final words.
Wow, I just love these questions, and I just want to end, it's going to be very short, but I wanted to thank my nephew. Where's Evan? There's Evan, okay. This is my nephew, Evan, and he got out of school today to be our photographer, and yeah, thank you, Evan. It was a last minute thing. I asked my sister yesterday, and she said yes, and he said yes, and so I think we're gonna have really amazing pictures from the day, and I can't wait to drive him home to hear about his impressions. He's 17, so you know, he's in high school now, and I'm not gonna say much. I always end kind of the same way, and it's been in this room where my parents were here earlier as well, and it's a quote from my parents, and it's kind of been in our family forever, and it's about their marriage. And anyway, it's this: the best is yet to come. So thank you, everybody, for being here, and we're still, I guess, reading all that. But that I think is the message, that we're all coming together, and really, I just felt so inspired listening to the panel and listening to Larry kind of bring it all together for us. And I really have a sense that that quote of "the best is yet to come" is true for us. And I think just some final thank yous to our, our committee. We've been working together every week for probably like the last 4 months on the calls to plan this. And it's just been just pure dedication and really hard work to pull this off. And I just want to thank this group for coming together, for the Colorado School of Public Health, Piper, the Center for Bioethics, and of course the team. I don't know who's all here still from my center, I see, and everyone from the Center for the Study and Prevention of Violence who has worked really hard behind the scenes. Yay. Yeah, there's so many. I didn't make a list or anything because I have too many thank yous. So, and thank you to all the speakers. This was an awesome day. And really, it's a start of this next year of recommitment and to moving forward to focus on prevention. So thank you, everyone, for being here. Thank you so much. Bye-bye.